Okay, so I will share the screen now. Can everybody see the screen?
Yes.
Yes.
Okay.
Yes.
So we will begin with the prayer. Everybody sit comfortably. Your back should be straight but not stiff. Raise your hand, both palms should be together at heart center. Eyes closed, mouth closed. Inhale from nose and exhale from nose. Take a deep breath 3 times. Again, again. Now we take a deep breath and while exhaling, chant a long Om, followed by another breath with a short Om and the prayer. You may turn off your microphone so there won't be any echo problem, and I will sing this prayer. You may sing also at your home, but it will not be heard to me. So inhale. Om. Again inhale. Om Sahanavavatu Sahanau Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu Ma Vidvishavahai Om Shanti Shanti Shanti. Now inhale, take your hands behind, hold your right hand with your left palm at wrist. Inhale, bend backward. Exhale, bend forward and do Bhunaman. Give respect to Mother Earth. Inhale and sit up. Keep your eyes closed. Rub your palms. Generate energy. Cover your eyes and let energy transfer to your eyeballs. Slowly open your eyes 3 times and dissipate the energy in your body. So with this prayer we say that Om, may we all be nourished, we all work together with great energy, and may our knowledge be radiant. May there be no differences or disputes between us. Om, peace inside, peace around, and peace between. Namaste. Now, I will share the agenda for today's meeting. So, we already started at 1 o'clock, and we will be doing the welcome and prayer, opening prayer is done. So, then will be introduction, short introduction for all the faculty, resident faculty today, followed by first session of counseling, the counselor by Dr. Punit Mahendru. Then we will have 10 minutes break at 2:20 to 2:30, followed by communication session by Dr. Punit Mahendru. And at 3:30, we have a guest faculty with Dr. Kailash Joshi. Rajwin Rangarajan will be there. He'll be talking about privacy, confidentiality, fiduciary, and conflict of interest. Then we'll have closing discussion for 15 minutes amongst us, and homework, then closing prayer. So this is today's program. So let us begin with the introduction. As you know, Dr. Punit Mahendru is very active at HCI, and she is a practicing psychologist for more than 25 years. She is currently working as senior staff psychologist at Kaiser Permanente in Fremont, California. She has done PhD from Rutgers University from New Jersey and MPhil from National Institute of Mental Health and Neurosciences at Bangalore, India. Dr. Mahendru brings us a lot of information, and she has been professor. She has been faculty member for several states and private university colleges also in US. So this is about her, Dr. Mahendru. You will know much more about her than me, but I know she is a very compassionate person. Dr. Kailash Joshi is our resident faculty. He is the founding member of HCI, as we all know, and very dynamic and active person. And he has served IBM for many years as a division general manager. Doctor, he has done doctorate from Cornell University, and he is very active in social community services. He has started several organizations also like HCI, like TI and AIF, Artificial Intelligence Foundations. So these are some short words for him. Otherwise, he wears multiple hats. And today's guest faculty is, is Arjun Rangarajan ji. So Arjun ji is a technology lawyer, admitted in practice of California. He is a graduate from IIT Madras and RPI and UCLA School of Law. Arjun worked as an engineer for several years before going to law school. Law school. And he's graduating from law school. He has worked in prominent law firms representing both large companies and smaller startups. So Arjunji had the wonderful opportunity of being introduced to HCI as part of his pro bono practice. And this is my introduction. You know, all know me, and I was a student, a scholar in batch number 3. And recently I graduated from HCI, but I have been interested in yoga and meditation since my childhood. I have done several courses of yoga in India, transcendental meditation course from Maharshi, Science of Creative Intelligence course, and I was teaching at YMCA also yoga, and then the YIC from Vyasa, LA. And I'm basically, primarily, I'm a instrumentation analyzer, instrumentation engineer, and worked at several places in different cultures, different countries like India, Kuwait, Canada, and the United States of America. Now, I will hand over floor to Dr. Puritji for beginning the counseling for counselors session. So please join me welcoming Dr. Punitji.
So, a question for everyone. So, this is, are others getting a feedback? Because I'm getting a feedback.
We can hear you, but you are cutting off sometimes.
Somebody has two devices open, please.
Everybody, please mute yourselves.
Yeah.
Okay, let me try. What I've done is I moved my phone far away from me. Let me move it further away. Looks like it's got better.
Now you're better, I think.
Okay. So today's we'll learn a little bit about what counseling is, especially what to expect as counselor of Hindu tradition. We'll also learn a little bit about some of the key elements of counseling skills. And feel free to ask questions. However, it's kind of good if we contain them for our question answer session, or in between as we speak. I might take a couple of minutes in between and say, okay, if you all have some thoughts or feedback or comments, this is the time to dialogue. So the homework question that you're going to get is, what is the role of worldview in counseling practice, and how would you define your worldview? So as I talk about the worldview, just pay attention so that it becomes an easier a homework assignment for you. Okay, but that might be a new concept. So moving on now to our next slide. So first of all, I want to start with actually a little piece of an interaction. And I may not get to all of you, but I just wanted to ask you, why have you chosen to counsel others? What is your reason for being a counselor? Would anyone like to go ahead and answer that? Just share that.
Yes. I forgot.
Should we just jump in or?
Okay, yes, go ahead and jump in.
Okay, so I think in my case, I mean, I'll just be, I mean, I'm not, I just want to be there. I'm not ready to counsel yet because I'm learning it right now. So from my perspective, if somebody is in need of something or somebody needs to talk to somebody, I want to be there. So that's my first step here. I am there basically as a human being to serve at the end of the day, but I need to understand first how do I approach it?
Okay, can I say? Okay. My name is Rita Sheth, and I've been helping in my community and schools about last 20 years. And I thought it's so nice that if I have some kind of professionally learn and help the students or elderly people. So definitely education help. It can mold me better. Thank you.
Yes.
I'd like, I'm currently doing a course in yoga therapy, and the yoga part is easy, but have to talk about, things that they're going through, and then it becomes difficult. So I really don't know how to do that, and I want to learn, and that's why I'm here.
So I know some of you might also want to share, but I'm going to just go into the discussion here. So you see, it's really important to know what our personal motivation is. That we of course want to serve, and we want to give back to the community, and we want to, do our dharma. And those are excellent reasons. But it's also helpful to kind of identify if there are any personal reasons here. Because sometimes those reasons give us the sustaining power, when things get difficult. That personal reason pushes us forward. You may recognize that a lot of excellent, nonprofit organizations, they've been founded by people who've had some reason to start them and keep them going, and even when things become difficult. I think we are at a, yes, I think we are far away from our slide. The next one. Okay. So it's kind of just important to really be honest with ourselves and ask ourselves, well, why is it that we want to be a counselor? Do we want to be a counselor so that we have something to give back, or is there some specific reason that's egging us on, or could there be some other reason? I'm trying to maybe find something productive to do at this phase of my life. So kind of trying to look at that very closely and having a clear idea. The reason why that is important is that we kind of have that sense of humility and recognize that it's a two-way street, that not only am I giving to the others, but in the process of counseling others, I am receiving some kind of a gratification or a payoff, a psychological payoff, so that gives my existence meaning and value. And when we keep that in mind, it allows us to be humble in the process and have that sense of respect and compassion for the other person. Now, counseling actually has it's really very important. It's very embedded in our Hindu culture. From I think right from Krishna's. A lot of people call Krishna the first big formal Indian counselor, and as he has counseled Arjun. But even before that, there have always been these sort of guru shishya connections where there is education along with counseling, and so that's sort of embedded in our culture. Then traditionally we've had counseling through astrologers, through pundits, through the elders in the family. So when we look at the word counsel, it's really broad, and so many different scenarios come up. They can be legal counseling and family relational counseling, and so many different things. So kind of good to understand why the CHT counseling is important, or why as a counselor of Hindu tradition, what role exactly are you going to be playing? So during the orientation session and during some other session, again and again, what keeps coming up is that whenever we encounter someone and going through a difficult period, I think someone had mentioned earlier whether a family member is going through some difficult time, or a family member has done something that is possibly not right, or if there is domestic violence involved, or if we hear of someone who's attempted suicide. So suddenly we want to jump in and help, because people who are choosing to be counselors are by very nature compassionate and helpful, and we want to help. We want to understand here that our scope as counselor of Hindu tradition is limited in its nature. In some ways, it's just a step beyond guidance. So we have guidance, and we have counseling, and we have therapy. We have these three things that we need to recognize the difference. There's a lot of overlap, a lot of skills are in common, and yet there's a difference. So in guidance, there is very directive, giving information, letting people know what is available where, how to approach it, how to get to a certain goal. Like, there can be educational guidance, career guidance, and so on. Then we have counseling, which is a little less direct than guidance. Here there is, it's not just a single session, though it could be. Here there is some little bit more of a relationship with the client. And we use that relationship to bring about some kind of a change, if indeed that is what the client may want. However, we are not counseling people who are experiencing clinical issues, such as, clinical issues, you can think, of course, clinical issues can also be social issues like counseling, domestic violence, depression, and if anyone is kind of gotten connected with drugs. So those are clinical issues, and we don't jump in there. Over there, our role as a CHT is going to be to just provide the guidance and to connect people to professional counselors, to clinical counselors, which as CHT we are not. So our role is really that of a liaison, of a warm handoff, to connect them. Our scope is to counsel, quote unquote, functioning people, which some people may also refer to as quote unquote normal people, though I don't quite like to use that word in this context, but people who are just fine otherwise, but may have some isolated issue, and you can work with them regarding that. However, if they are experiencing some long long-term depression or some other difficult situation, then we want to just play the role of a liaison. So that's kind of important to remember. Then, of course, there is therapy, which is similar to counseling, to clinical counseling, but there the relationship is more sort of drawn out and a longer period, and we probe a little deeper. Usually issues are deeper, and usually the persons who are involved in therapy may be wanting to bring about some deep psychological change in their life, right? So that is what we want to understand, what our role is going to be. And given that role, understand why we are going to be, why we are choosing this, and how it can be of mutual benefit to us as well as our client. The second thing that we want to be aware of is what is our strength. I mean, sometimes certain things we know well. We might know yoga well, or we might know Bhagavad Gita well, and we use those strengths to counsel people along those lines. And of course, when we are counseling, we also make a commitment to increase our own awareness and growth. We become counselors, but we don't do anything to expand our own sense of knowledge and our personal reflection. Then we're not going to be very effective as counselors. Counseling is a very mindful kind of a process, where we are mindful of who our client is and mindful also of who we are and what's going on. Which brings us to the next slide here of who we are as counselors, and also who our client is. It's really important to understand the psychosocial context of the recipient. Who are the people that we are counseling? Are they people from India? Are they people who are now settled in the US or Australia, or wherever they might be? And if they are indeed settled here, are they first generation immigrants, or are they second generation immigrants? Because the issues that come up for first generation immigrants can be very different from the issues that come up for the second generation immigrants. And that is what we want to be careful that we are not imposing our values on others, right? So now let's look at an important issue that comes up when we look at values, and that is collective and individualistic worldview. Most traditional cultures, as Indian, Hispanic, various other traditional cultures, they are collectivistic in nature. What that means is that family is priority, and families are together. There's a close bond between different family members, and the welfare of the family is placed above that of the individual. Now we can have the individualistic worldview, where the individual's potential is considered of paramount importance, and the family's welfare though important, is secondary, right? So it's just a question of what comes first. Now, do you see that, I want to throw this question out to you all, do you see that there is any kind of a difference perhaps between the culture that you are might find yourself in the US and the culture that you were raised in, and what that difference might be? I'm going to open it up to all of you.
Namaste, Punitji. My name is Ramya Tadacharya. So I'm a trainee in the psychotherapy field at this point. I'm building up my hours to do my licensure, LMFT licensure. So I greatly appreciate your presence here today. And my question is a little bit based on my experience here as I support, people of various background in therapy. How would we view what the Western psychology talks about as codependency vis-a-vis how that needs to be factored for those of us who hail from the Hindu civilization where there's so much interdependency in family system? How do we make sure that we do not impose the Western lens onto these, Hindu family of systems? Is something that I would greatly appreciate some basic insight on, not to take too much away from the time here.
Yeah, Ramya ji, maybe some of it I'll touch upon, and some of it we can definitely talk about it some more, because sounds like you have a very specific question, and I may not be able to do justice to the answer here. I have only, I think, 45 minutes to cover the rest. So so I'll talk about it just a little bit. Nandkishore ji, maybe go back to the worldview slide. So, so kind of when we look at, let's see how we can consider worldview, how we can define it, what are the factors. So it is one's values, one's beliefs, what our culture is, comes in identifying our worldview. Then in the Indian culture, there may be some mysticism. And then there is this understanding as to who our support system is. Family is a support system. And then what kind of stressors come about in this collective, culture. For instance, the pressure from family to be a certain way, or to do certain things, or to assume certain responsibility. Also, this worldview that we have very often sort of imbibed is that we kind of accept a very authoritarian kind of structure in the family. There's, as Ramya ji mentioned, there's a lot of interdependence. And there is a desire to conform to family norms that is of paramount importance. And the relationship with extended family is maintained. The goals of the family are collective goals. And, there is also a different kind of an interpretation of silence, right? When someone older than you asks you a question and why didn't you do this? You may answer, or sometimes you may sort of defer and be silent, because if you answer, you might hear back, jawab deta hai, if you follow Hindi, that how dare you answer me, right? So there is a different understanding of some of these things. Now, in the individualistic culture, as I said, the focus is on developing one's potential to the maximum. Now, you can kind of start, I think sometimes first generation immigrants might start thinking of this individualism as selfishness. And that gets kind of tricky, because that already means that we have adopted a value, right? That we are right and in being collective, and the other person is wrong in being individualistic. So we've got to recognize that these are just two different approaches, because even in the collective approach, you might be aware how some people become the scapegoat, in order to keep the family values intact, in order to get the family moving forward. Sometimes certain people's well-being can be sacrificed. And perhaps when you hear those stories, you will realize that they're not very ethical. So that can happen. Now, in terms of individualistic worldviews, sometimes the person can focus on himself, but still be caring and still be compassionate. So it's not like one is right and the other is wrong. It's probably just two different approaches. And keeping that in mind is important when we are counseling the person in front of us. It may very well be that there's a conflict in worldviews between the parent and the child. I mean, so the conflict comes up because, the parents come to you and say, my children are not listening to me. And really, it's a question of a clash of worldviews, a clash of values. So recognizing these two perspectives, and also if there's a conflict in your own values and the values of your clients, recognizing that is important. So sometimes if it's a very strong conflict, you might have to defer to somebody else who can sort of handle that. For instance, I can think of a colleague of mine who had this very, very strong bias that abuse needs to be called out as it is, and abuse is abuse, and I'm not going to help anyone develop coping skills when it comes to abuse. This was actually my colleague, who was also my neighbor, his perspective. And what would happen is that clients would just drop out because especially if they were Indian, because the value that was placed on keeping the family intact was far greater than, not tolerating abuse, right? So then that person had to sort of defer the treatment to somebody else. And we might find ourselves clashing with someone with regard to their values. And if we are able to respect, see their point of view, great. If not, we may definitely, we can certainly refer to someone else. So, and once again, recognizing that we are not going to be jumping in and counseling people who really need to be seen by a professional counselor or professional therapist. So we can't do it all. Let's not think that since we are getting into counseling that we can approach anyone and everyone who's suffering. We can perhaps connecting them to the right source, to the right person, might indeed be the best that we are able to do. And there is a reason for this. You see, when someone gets help from, say I am, say someone approaches me because they have abdominal pain, okay? And I happen to be an amateur, a hobby homeopath, so to speak. And I kind of give them something and they are okay, they feel complacent that, oh yeah, we've seen this Dr. Mahendru, and she's given us something for our stomach, and they can get complacent and not seek out the right kind of help. And that could lead to further problems. Maybe there was something really wrong with the colon, and so on. So in our situation, as when you're approaching someone who is depressed, or who has a daughter who's depressed, and they say, oh, we've approached the Hindu counselor, and if this daughter happens to be 16 years old and she's not going to school and she's not eating, she's not sleeping, then what could happen is that the parent might think that they want appropriate help, However, the daughter actually not get the help and start getting herself. Okay, so I see a lot of background. Anyone who's not speaking, please
I think
just
this Sangeet ji, you need to go mute. Hello.
Kailash ji, if you're the host, you can mute Sangeet ji. Can you please mute him?
No, I'm not the host.
Yeah, Kailasji, you can mute him. I made you a co-host.
Oh, 1 second.
okay. So so we may then uh, we may think that we have helped, the parent might think that we have helped, and the teenager may not get the kind of help that she really needs. Now, instead, if we were to just say that I understand this is a really difficult situation and I'm happy to talk to you, but I really think that you need to get her some professional help, and here this is the phone number of the person or a phone number of the organization where you can get this help, and please let me know once you have connected with that person. That is probably a better thing to do in this situation. Okay. So we now talking about our scope. We've discussed it. This is mainly guidance, some counseling, but limited to some very, very concrete issues, not necessarily any underlying clinical depression, anxiety kind of issues. It's important to understand who it is, what's going on with this person, identify that, to assess the situation, who is the person, what's the person's worldview, is this something I can do? Is this something that would be best done by another colleague of mine who happens to have more skills or knowledge in this? Or is this something that is best addressed by a clinical person, and let me give them the references, right? So this is our assessment of the situation, of the person, of our role in all of this. And we do have the entire session on ethics, but just keeping in mind that we want to create a very confidential and very structured situation here. We are not going to be going to their house randomly or, because when we think of counseling from a family member and, someone else, it's a little bit more informal and unstructured. But here, as a CHT counselor, and we're going to have far more structured session. So maybe just may I quickly have a look at the next slide, Nankishorji? Yeah, okay. So counseling, it's rooted in the principle that individuals can help themselves provided they receive the right kind of support. So we are not here to advise or tell people how to do something in a certain way, whether they should or should not be doing something, but just listen to them and provide them a safe space, privacy, safety, hearing them out. The main thing is that we connect with them. We not just inform them, but we also connect with them, and we keep it very time bound. As soon as you approach the client, you let them know, I understand that you have this concern. I would like to spend perhaps 2 sessions or 4 sessions with you so we can kind of look at it and see if you might be able to come to some kind of a resolution of this, right? So you define it right from the start that, I'll meet with you once now, and then we'll get to know what's going on. Let's connect with each other. I'm here to support you. And then perhaps we can touch base again after 2 weeks, and then again after 2 weeks. And so create that, because otherwise what's going to happen is if someone is experiencing loneliness, or if someone has an issue that they are not really getting the right kind of help with, they'll kind of constantly replay the tape again and again and again without any change happening on their side. And you might start finding yourself getting frustrated and burnt out. So just define it that, I'll be seeing you for 3 sessions or 4 sessions, or whatever you think your assessment might be of how long it might need to work with this person. For instance, if someone is going through grief, you might say, we'll meet for about 6 sessions. Remember, you can always extend that. At the end of 6 sessions, you can always say, yeah, I can see you've made a lot of progress, but perhaps maybe we should meet 2 more sessions. So you can always extend that. But if you don't, you will have a difficult time sort of cutting the cord, which you must if you're going to want to help others as well, right? And already talked about how it's more direct, and how the good thing is that as a counselor, you can sort of address a really wide range of issues, maybe not very clinical issues. You can kind of address education, job related, grief, adjustment, parent child. So different kind of things that you can sort of approach and address. And that indeed gives you the power. And perhaps the best thing would be to allow them to get comfortable with this concept of seeking help, because people, especially people who are from the Indian diaspora, they don't like to talk about things that are bothering them in the public or with a stranger. And we are tolerant to a fault, right? Very, very tolerant of things. I mean, one parent who's, 16-year-old was not eating, not going to school, crying all day long. She just thought that it was just teenage issues, right? Very tolerant. I mean, we tolerate a lot before we consider something as being not okay, and something that we want to get help with. Same thing with, I think there was some question in the chat, what about domestic violence? Same thing, the woman would or the guy, it can be both, though of course, more often it's the women who and will tolerate a lot, because we must tolerate, we must keep the family together, it's our responsibility, and I don't want to break up the family unit, and the children must have an intact family. And those can allow the person to tolerate a lot of abuse. So there is already an enormous amount of resistance to talking to a counselor, especially to a clinical counselor. So as counselors of Hindu tradition, you can bond with them along some Hindu principles, and they recognize that you are aware of that you share some values, maybe not all, but you share some values about the Hindu Dharma, that you understand the role of an intact family because you sharing that culture with them, or and therefore raise their awareness and allow them, hold their hand as you facilitate their moving forward and getting help. A lot of people right away ask about, what about domestic violence? Well, you are not going to become domestic violence counselors. I want to tell you that even after more than 25 years of working in this field, and having worked with many, many women who are experiencing abuse and domestic violence, when I see an Indian woman in the first session who is experiencing domestic violence, I tell them, please contact the right agency. I am not the best person to counsel you, that there are agencies who do that. because there's a lot involved. There is legal issues involved, there are custody issues involved, there is safety involved, right? So because of all of that, we refer them to organizations who deal with domestic violence. So I do that after, some 25, 30 years of work as a psychologist. So I would advise you to do the same, that you just give them the resources. You can give them the phone number for SAVE, which is Shelter Against Violent Environments. You can give them the phone number for METRI, for Narika. You're going to hear from some of them, one of them, I believe, in future. But you can Google them. In case they are sort of distraught, you can just Google the number and give it to them. And what you can do is during your session with them, you can say, okay, how about I dial the phone, and you can speak with them. So it's just like a little bit of a warm handoff. So, you encourage them, you provide them with that strength to make that step. And perhaps on their own, they're not able to, but as they're talking to you in that session, they might be able to. So that is all that you are required to do in that situation. You are not going to be solving their domestic issues, all right? So just supporting them to reach out and get help. Let's see the next slide, Nankishorji. So let's look at what it might look like, how will it all work? For instance, someone will, maybe you get a phone. Someone's asked, is there a list of organizations for our reference? Yes, we do have a list, and we can certainly post them in some place. I don't have that. I'm not sharing that with you right now in a slide. But depending upon where you are, that's the problem with these lists, that that they will vary from place to place. Now, if you happen to be in the Bay Area, I can tell you it is SAVE, Shelter Against Violent Environment. And it's METRI and it's Narika. METRI and Narika are Indian organization, and SAVE is more of a county level organization. And SAVE, which is based in Fremont, the advantage of that is that they have better funding, and they are connected to Narika and METRI as well. And they have people from different languages that can help them, and SEWA as well, yes. And, you can just Google there. I mean, you say SAVE, domestic violence, and you'll get the phone number. So it's really as simple as that. And, a referral to them is the best thing that you can do. I mean, people ask me, is there a reference for this and that? Really, some of the resources will vary according to the zone, and maybe we can document them down the road. So it's really important to just kind of be comfortable with the process. Sometimes we get scared. How am I going to do this? Do I have to know all about domestic violence? Oh my God, I'm meeting this parent whose son has, whose son swallowed 20 pills 2 days back. What am I going to do? There's this fear that is connected to with the idea that you have to fix something, and really you don't. It is both. I mean, it's really not in your power to fix anyone, and in a way it's a bit of a relief that you don't have to take that on, right? You cannot fix them. All you need to do is meet this person in a safe, compassionate environment, and establish a connection. Let them know that you are there for them, and establish a rapport with them, and we'll talk about how that how you can do that as we go along. So that is the key thing. Just, okay, I'm going to meet this person. I don't quite know what the problem is, but let me just meet them. Let me meet them warmly. Let me talk to them, find out what's going on, and not be afraid to ask the questions. Mr. David, I'm saying that on purpose. I don't want to give any Indian last name here. Let's meet and talk about this. I understand that you're going through a difficult time. This and this has happened, and this must be a very difficult period, for you. So let's just sit and talk about it and see if we can come up with some ideas. So just, you don't have to resolve and fix their issues. You just connect with them and talk to them in a friendly manner all the time, keeping some guidelines about the structure and ethics. Okay. And using some skills which we'll discuss later on. And then in the end of, after your 45 or minutes or 1 hour is in, you can say, I'd love to talk to you some more, but, we're coming to the end of our session now. Maybe we can meet for 3 or 4 sessions. And shall we meet on such and such day? Would you like to meet on a weekend, weekday time? So have a clarity about when your next session will be, what time, what day, for how long, and how many sessions, right? And then, you can kind of disengage. And once you come back, you, of course, document everything, which Manglaji has written, on your manual, how to go about that documentation. So you do that. So let's move now to the next slide. So counseling skills, some of these, I think Mukunji also talked about. So there's a bit of an overlap. So the utmost importance is listening skills, right? Attending, listening, observing, noticing what the other person is like, noticing if what they're saying and what their facial expression is, whether they match or whether they differ, right? And attending to what they're saying. Sometimes we look at a person and, they might be saying that, oh, I lost such and such person in my life. And you'll notice that as they say so, they have a little bit of a grimace or a smile on their face. Or they might, so you see that you recognize that here perhaps they have some kind of they're feeling a little bit closed about sharing their emotions. When their facial expression is not matching what they're saying, that they're reluctant to share about something, they're reluctant to have access to their own emotions, right? Sometimes, you might be busy, a phone call, maybe, someone might be calling you, or there may be something else going on, and the person walks in and you say, yes, go on, I'm listening. Well, that isn't very helpful either, because you want to be very respectful, put your phone away, get rid of all distractions, and give them 100% attention, right? And so that is super important here. And then the other thing is to really express empathy. I think Mukunji mentioned what is empathy and sympathy and compassion and the delicate difference between all of them. But the whole idea here is that you are able to put empathy really means being able to put yourself in the other person's shoes, being able to see things from their perspective. And that requires, once again, certain skills. some of the skills that are really valuable for empathy, you can say, yeah, I really empathize. You can't keep on saying that I really empathize with you again and again. You want to be able to express that in a few different ways. One way to express, and this is something that we can learn and as we go along, one way of expressing empathy is to paraphrase. What paraphrase means is that whatever they tell you, you say that in a different way, right? So you express the same thing. So they might say, my son, he doesn't listen and this and that, and he doesn't go to school and so on. And you might paraphrase and say, so I hear that your son has not been very respectful towards you, right? So you're paraphrasing it. You're saying what he's saying, but in different words. Another important way of expressing empathy is that you reflect back what the person is saying, or you reflect their emotions. Gee, you sound really disappointed that your son is not listening to you. Gee, you find it very disappointing that your husband is not being respectful, or or this is breaking your heart to have to take such action as you're going forward to call a domestic violence organization. So reflecting means you share with them their emotions that you are finding as you have that conversation with them, right? Then it's also important to be genuine. If, for instance, you find that in a given scenario, you cannot empathize with the person, but because you're a CHT counselor, you're trying to very hard, but you find that you just cannot. So for instance, the value system is so different. As I said, it's better to maybe refer to someone else, because clients can come to know when we are not all into the conversation or into our session, and there is that feeling that gets communicated. So definitely having that genuineness is important. Another super important thing is non-judgment. And you'll hear this again and again. Judgment is actually, you might have heard about AA for Alcoholic Anonymous, right? And for people who get addicted to alcohol, there is AA. Now, people who get addicted to food, there is an equivalent of AA. That is so hard because we all need food. Likewise, being non-judgmental is so hard because we always need to retain our judgment. We always need to have that ability to categorize. The ability to categorize things into different segments is a basic function of our brain, of our human brain. Animals don't do that, we do that. So it's such a basic function, and we need that function in order to navigate through life. So in the session with the client, to let that go, or in an interaction with a family member or somebody else, to let that go, to set that aside, that becomes really difficult. But that is a skill that we are going to develop and navigate. We might succeed sometimes, not succeed sometimes, but all the time we maintain a level of mindfulness or awareness. Are we judging this person as being good or bad or right or wrong? Are we judging this person from our value system because we believe in intact family, or because we believe in, being sort of emancipated and independent? So what is our value system, right? Can we set that aside in our interaction? And connected with that is unconditional positive regard, right? Um, can we express that we care for this person and that we care for them without judging, and we accept their viewpoint as they express it. We might not agree with it, but we accept it. And can we validate their concerns, their pain, with the utter respect, just holding it with, so holding their value very gingerly, with a lot of care, as if, they're really that valuable china, so to speak. So kind of with so this wonderful dance of being friendly and genuine and spontaneous on one hand, but at the same time non-judgmental and caring and respectful and accepting on the other hand. That is counseling, right? And it's hard. It's so simple and yet so hard, right? Another thing that's important is staying on the agenda. You will find this to be really difficult because, say someone is here and they have never not been able to talk about their issue with someone else. There is a tendency, for instance, if I see a person who's been married for 20 years and they have difficulty in their life, they invariably start off from, in my family, when I was 21, this is how we did these things. And in his family, this is how we did it. Now we've got 50 minutes. And you can imagine if I start listening to how their meals were organized. Now, I'm not saying it's not important, but there is a kind of a long long way to go till we can come to our agenda item, and that can become tricky. Now that's really important for both of you, for everyone actually, because if I listen to this person's family dynamics when they were 21, and which I must at some point get to know about it. But if I do that in the first session, and after 50 minutes, she has just been able to tell me how she and her husband met, and we end the session, and she really hasn't been able to discuss the problem. So when she leaves, she says, well, I was just talking like I might talk to anybody else. I didn't really get anything out of the session, right? And you might also sort of feel that, what was I doing here? I mean, we didn't really work on anything. So, then the client might drop out. They might not value your connection and your sort of role in whatever they are trying to resolve. So it's really important to stay on the agenda, not to bring them back. I understand, and I would like to know more about that in the future. But today, could we just talk about what brings you here and what are some of the things you want to resolve? And this might also be redirecting them to that which is in front of you, right? To that which is happening in that very day. Another thing which is sort of related in some ways to ethics, but may not be addressed entirely from that angle, is that of self-disclosure. How much of disclosure do you make when you meet someone? What are the kind of things that you share, and what are the kind of things that you don't share, right? This becomes especially difficult with Indian clients because they like to know more. For instance, my American clients, 99% of the time, they will not ask me if I'm married, and they will not ask me if I have children. But my Indian clients, 99% of the time, they will want to know if I'm married and if I'm children and how old my children are and if I have a boy and a girl or both girls or both boys, right? So they absolutely want to know a little bit more. They're naturally curious. It sort of results from that collectivistic nature. So I have to then decide, well, where do I draw the line, right? So how much disclosure is going to be okay? And is that disclosure going to cause any problems for us? I mean, is it okay for me to say, yes, yes, I'm married and I have adult children, as opposed to what perhaps another, maybe a non-Indian counselor might say, well, that's not what we are here for today. If I was to say that to my 55-year-old client, she would take offense to that, that why that you can't even share this much about yourself. So kind of just figuring out how much of disclosure might be okay. Now, on the other hand, saying that, oh yes, in fact, I happen to live down the street from you. That might be much, right? For me, I mean, it might not be that way for you, especially if you're meeting someone close to their home. But so that for me as a therapist might be too much of a disclosure. So just kind of trying to assess where you are with that is kind of important. And then, interpretation, we want to, one of the questions in last year's conversation was that if all we are giving them is referrals and all we are doing is listening, well, I mean, where exactly is the counseling? I mean, they can listen to anyone. So I think the counseling is in addition to giving them the correct referrals and resources, it also is because you will communicate some understanding in an unbiased manner, and some interpretation, some assessment. This is how I view things, and do you think that I've got it right? Kind of summarizing. Do you feel the same way about this? Are we on the same page? And if so, do you think this and this will be helpful in future? And see what they have to say. So I want to go on to the next slide. And I also want to ask you, Nandkishorji, how are we doing with time?
Yeah, we have to take a break in now 2:20, so it is 2:12 now.
Okay, great. Let's have a look at the next slide and see how much more we have. Okay, so here we have some important skills. One is flexibility, kind of meeting the client where they are, not trying to impose our values and being too eager to help them, trying to sort of, meeting the client where the client is. This is something very, very valuable, because sometimes we may want to rush them along because we want to help so desperately. Our desire to help can actually reach, and a drive to help might push them further than they want to be. And in that case, they may drop out. So we've got to be very, very patient and meet them where they are. If all they want to do in a session is talk about how difficult the situation is, then in the first session, we may just want to listen to them and validate the difficulty they're experiencing without necessarily moving in, resolving anything. So that's to have that flexibility, have the patience. You need a lot of patience in counseling, because it's easy to get irritated when you are seeing a person repeat the same story several times. So kind of just being mindful that they are in a different place, that they are stuck a little bit, and perhaps we can meet with them before we kind of give them a nudge. Sense of humor is very helpful. That is, if you happen to be a person who is witty, right? You don't have to put it on, but otherwise, it's a great skill to have. And not insisting on problem solving, refraining from giving advice, just allowing them to say out something aloud, be a sounding board. And as they say something aloud and you just paraphrase, reflect, summarize, they will be able to deduct their own solutions, deduce their own um, counsel, so to speak. And different people have different skills. If you happen to be a person who's a great storyteller, by all means use that skill. You can narrate small stories and anecdotes. If you happen to be a person who is very familiar with Bhagavad Gita as well as Bhagavad Katha, by all means use anecdotes. This is the same exact issue that came up between Dhritarashtra and Duryodhan. You can kind of say that. If you think that the client is also going to be able to receive it. So you figure out what is your best skill. For some of you, this best skill might be providing education along certain lines. For someone else, the skill might be, well, let me teach you some yoga postures because that will help you relax. For some of you, it might be, um, anecdotes, storytelling. So you can figure out, okay, what is my, what are the skills that I like to use when I'm with someone trying to resolve certain issues together. Let's move on to the next slide. So, a lot of our I have used a lot of our Hindu concepts in counseling. They're just so useful. And actually, when I put them in the perspective of Bhagavad Gita for my Indian clients, they are super helpful. For instance, when a woman who might be going through some abuse, not necessarily physical violence, but might find that something is so unfair. But he didn't do this with my family, so why should I do that with his family? And you talk a little bit about dharma, that if he's not following his dharma, it doesn't mean that you don't follow yours, right? Two negatives don't make a positive. Then, of course, karma concept, you all understand. It's sometimes people themselves will come up with it. Well, it must have been my karma, which is why this is happening. Surrender, love that, absolutely love that. In fact, surrender is a concept in all religions and cultures. And, of course, Krishna talks about surrender to Arjun, that, surrender unto me. Don't try to distinguish right and wrong. Just follow your dharma and surrender unto me, right? So in Christianity also, when we have this idea of thy will be done, those of you who know that pray, our Father who art in heaven, hallowed be thy name, thy will be done, thy kingdom come, right? So that's surrender again. So is surrender. Then in AA, in Alcohol Anonymous, we have this wonderful, what we call the serenity prayer. God grant me the courage to change the things I can. No, let me see. God grant me the serenity to accept courage to change the things I can, the serenity to accept the things I cannot change, and the wisdom to know the difference. That, in essence, is surrender. In mindfulness, surrender is an important concept. So all along religions and communities, surrender is useful. So when we are talking to our Hindu client, we can definitely use the Bhagavad Gita shlokas to talk about surrender. Then acceptance, that's connected to surrender, as we talk about the serenity to accept the things that I cannot change. A lot of people talk about, well, I cannot accept it. You're asking me to accept abuse? how can you do that, Dr. Mahendru? It's kind of important to know that acceptance and complacence are two different things. Unless and until we accept something, we cannot change it. By acceptance, we mean acknowledging what the reality is. It doesn't mean that we agree with it, but we acknowledge it and we allow it to be the way it is, right? And connected to surrender and acceptance is the concept, which is the key concept of Bhagavad Gita. And I have been cheeky enough to suggest that it be the shlok that we adopt at HCI. Let's see what will happen with that. But it is focus and effort, not the outcome, right? So in counseling, you too do your best as you counsel the person to resolve an issue, connect with them, use good listening skills, good communication skills. But remember that the outcome is not in your hands, that you cannot fix or change anything. And keeping that in mind allows, if when the client accepts that, it allows them to be more peaceful. When you accept that, it allows you to be less frustrated that the outcome is not what you would like it to be, right? Then the idea of witness, once again, that is from our Bhagavad Gita, to witness all the things that are going on without judging them. That's the whole idea behind witness, is to not necessarily constantly engage in what's going on, not to always fight and argue with reality, but just let it unfold the way it unfolds. Then pain versus suffering, it's a, once again, it's a, as a concept, it's been made more obvious in Buddhism, which we believe is an offshoot of Hinduism, that, you know, painful events happen to everyone. I mean, this is something that I have found a lot of people struggling with. When something painful happens, they feel that they're justified on dwelling on it and talking about it again and again and again. You know, wouldn't you if this were to happen to you? You know, that kind of a thing. And not being able to get past it, getting stuck in it, sort of constantly regurgitating the painful event. While there is some value in sort of talking about it and processing it, but when we repeat it again and again, we only end up enhancing the suffering we experience. So that's an important thing to remember, that listening to someone is good, validating, being compassionate is good. But once they have told their story for the nth time, it is no longer helpful for them also. Not for you, definitely, you're probably tired of it. But it's also not helpful for them because it's making them stay stuck, and it is also enhancing their suffering, right? Then soul consciousness and reincarnation are also concepts that we can definitely bring in here, because it allows us to have that sense of continuity, and that play a role as we counsel in the Hindu context. What do we have next, Nankishorji? Okay, this doesn't come in here. So actually we have ended our first session, and I know there were quite a few comments in the chat, so I'm going to go ahead and give 5 minutes to anyone who has a burning question that hasn't gotten answered yet.
Puniji, just to interrupt, this is Usha.
Yeah.
Namaste all. So do you think this would be a good time to introduce everybody to the discussion forum we talked about?
To do what?
The discussion forum in Moodle.
Oh, that they should add all this. Yeah, maybe you can have your comments in the discussion Moodle session in Moodle, and absolutely, by all means. And I haven't seen.
If I may, Usaji, I think
Yes, Kailashi?
that's a good idea. We are okay on time. Puniji is okay. That's a good topic to introduce for everybody's awareness. Yeah.
Yeah, I'll just take 5 minutes of your break, everybody. So I know everybody, I mean, this class, it just triggers questions, right? Everybody has questions, and our faculty have kindly consented to address any questions you may have that you post on Moodle. Okay, so I'm going to share my screen right now. Kishorji, can I
Yeah,
start sharing?
you can share it.
Okay. Okay. Just give me a second. Let me go to, yeah, right. I'm there. Okay. Let me start sharing. Okay. Share.
Yes.
So everybody can see my Moodle?
Yes.
Okay. So I'm at Sunday 4, right? And Sunday 4, you have all your session presentations. And at the bottom, I think you can see discussion forum for Sunday 4.
Yes.
So this is what Puniji has agreed to. Puniji and Kalashji for this session will be monitoring this, right? So you can go in here, click on this one, right? What happened? Oh, there it is.
Ushaji,
So you just say,
I thought that they post their comments there, and then Nankishorji can certainly take a look at it periodically, and I can take a look at it in a few days as well.
yeah.
I think the discussion doesn't necessarily mean that the questions will be answered, and I say that because some questions are so specific that answering them may not be within the scope of the blog.
Yeah, and they do have the option, if you're okay with it, to ask you that privately too here, right? Or they can reach out to you always privately, right?
Yeah.
Anybody can reach out to you privately, but you, I think Ramyaji, do you have a question, please?
Ushaji, I just wanted to bring it into focus about confidentiality. About, sometimes we enthusiastically share, how we've been able to help somebody in an effort to instill hope around in our community. Just because our Hindu community is very small within the Bay Area, I just want to throw caution to the wind about, what we do with who we counsel. And sometimes it's reflection for us if we have a strong urge about sharing what we have supported or the support we've given someone to somebody else. I think that's a nice time to sit and reflect and introspect as to why we feel the compelling need to share somebody else's story to another person. So just want to throw this out there. Thank you.
Yeah, very, very valid. And I would just say that when somebody tells you something in confidence, obviously it's in confidence. You do not share it in a this is meant to be more for if you have general questions or you want to share general ideas, like Puniji talked about, say, using the Bhagavad Gita as reference. So maybe you can expand on that. What are the other situations you've come across where you think whatever questions, basically it's whatever questions you raised your hands to ask Puniji right now in this 45 minutes, feel free to post it here. And some of you may come up with your answers. Please, we do not want anything confidential here, that's for sure, right? But you can post over here and you can just mark session 4 and you can go ahead and post. It can become interactive for you. And where Puniji has to step in or chooses to step in, she will step in. If you have a particular question that's also confidential, then please don't post it here. Again,
Yeah,
but I think you'll have a lot of fun interacting here.
Yeah, Ushaji, absolutely. I wanted to sort of piggyback on that. That, sometimes I find that people have a very direct, specific question, but they want to make it general, and it sometimes some questions are best answered when the specific information is available. There may not be very broad general answers just because each situation is different. And if there is something burning and you can't resolve it and you want to ask me individually, by all means send me a WhatsApp question, rather than because you'll be beating around the bush in the blog, and and or you'll be asking in the sessions in the classroom here, and it won't help. Then maybe there's something you specifically need and you're hoping to get the answer, and you might not find it here. Like if there is a one family member who's going through this, but then you camouflage it in the community, this and that. So it gets tricky to come up with one solution for everyone. Yeah.
Yeah, this is more like a general, like the way we want you to use it is, so you were sitting in a classroom and you just had your class and you had another 30 minutes. And what would you discuss? You can do that here, like a virtual classroom, after class discussion or something like that. This feature is available. And if you use it, then we can help monitor it. So I'm throwing it out there.
Usaji,
Yeah, and Ushaji, in this particular forum, other participants can also reply to anybody's
Oh,
comment.
yes, that's where it becomes interactive.
exactly.
Everybody, but please keep session for discussion only to what Puniji and Kalaji are talking. Don't cross sessions, then everybody will be confused.
Yeah,
Right? So each session has its own forum. So stick to the topics that are presented in that session.
I
Thank
think
you.
just the clarity, Usaji,
Uh-huh.
just to kind of clarify the point you just made, what we are saying is let us not use the WhatsApp kind of a function for topical questions. That is not a good place to throw. For topical questions, come to Moodle and use this forum. That is the first advice we are giving you, suggestion we are giving you. Second, Moodle problems, list them. Don't make everything a public discussion because it wastes a lot of people's time. That's the fundamental point. And I think any questions about homework, directly write to the FA for that particular session. I think those are 2 or 3 simple things that can make our communications much more effective, and that this is one of the steps in that direction. Yeah.
right.
Thank you.
Thank you, Kalaji.
Yeah, in the Moodle related question, Ushaji sent out the link for the spreadsheet. You can put there all the questions related to Moodle login issues. Okay, so now it is 2:32. I think we should have a 10 minutes break. 2:42, we should be able to come back again. And when you come back, start your video so we know that you are present here and we can start the session.
Sounds good.
Okay, so 10 minutes break now. Bye.
Oh, sorry.
Yeah, it is 2:43 now. So let us see how many are present.
So I can. Ah,
Yeah, they are started joining.
hello.
Yeah, go ahead, Panditji.
Is there an echo?
No, not at all. You are very good. Sound and clear. It was good sound, loud and clear.
So I just wanted to ask any
There is an echo.
takeaways?
There is echo.
There
There's
is.
an echo coming across.
It was not coming in. I don't hear anything.
But we do.
How is it?
And Kishorji, probably it's coming from your laptop.
Is it?
Yeah.
We cannot hear you now.
Now you're on mute, I
Yeah, no, I will turn it off. I will mute myself. Then let Punitji talk and see whether we get echo.
Good idea.
Somehow I'm not getting any echo. Okay?
Yeah, I think people are selectively either getting it or not getting it. Yeah.
Yeah, see, I am not getting a echo
And
at all.
now when she talked, it was fine.
Yeah.
And
So,
my mic is on.
so is mine.
Might be some other reason then.
I'm wondering if anyone can recount one takeaway from the last session.
Discussion.
Anything, any takeaways?
Um, the worldview question was
Definitely
interesting.
listening. This is Radhaji. Listening skills is very important in counseling, you stated, and you have to have empathy in counseling with someone. So listening skill is one of the key factor in counseling, as you stated earlier.
Great. Any other takeaway?
Yes, I like that you blend the Gita for the Indian people. And it's very good example. So that way we can emphasize our Hinduism things like this. What is the importance of Gita in your life also? So in the counseling, we are using that. That's excellent way, I thought.
Yeah.
I thought knowing people's worldview was important. Knowing what your worldview is also important because that kind of places them and makes you understand them more.
Hariam Punitji, I especially like that you mentioned that use your skill set. And sometimes we are trying to, do the best that we can in the process of even listening to family members and thinking we should offer some skill, and some things don't come naturally to us. And you gave two nice examples. If you're a storyteller, go ahead and do that. But you may know something in part of a yoga therapy or part of something that you know to calm yourself down. And you can share that which you're most comfortable with, and that's an inborn skill.
Yeah.
That was a good takeaway for me. Thank you.
Yeah, great.
And this is quite minuscule, but it really resonated with me when you said, when you're counseling someone and they get stuck in saying their same story, that they are not able to move forward because you're not accepting the thing to move forward. And I think that is good just in life for people to, when you're interacting with friends or family. So I don't know, that really stuck with me. I thought that was really good to hear.
Yeah, people are learning a little bit about counseling and therapy. So sometimes they have this idea that it means venting. And if we have to say the same story, we are venting our emotions again and again. At some point, that venting can become obsessive rumination. And then it's not helpful for anyone. Yeah.
I like the way you said rephrasing. How rephrasing can help, and as a counselor, I feel it helps both the client and the counselor itself to make sure that they understand whom and what they are going to help.
Yeah.
Excuse me, Punitji. There is still some echo and it's not very clear. Everybody else mute. I don't know why I'm not able to hear properly. Sorry.
Oh. I have removed my my iPad from the vicinity, so I don't know. Let me try.
And
So,
there is no echo coming in my computer.
so now how still?
Yeah, yeah, no, there is no echo.
Oh,
Ashwarteji, do you feel echo? Do you hear any echo?
How about
I do.
asking anybody with echo, please raise your hand.
quite a few. Wow.
How many
4
people?
people, 5 people, huh?
Okay, so that is a problem. And can we mute everybody and then see how it works?
Yeah.
Rita G is not muted. Sorry, yeah.
Yeah. Have you muted everybody, Kishore?
Yeah, Puneet, yeah, you are not muted. Only you are not muted. I just opened my mic. I can turn off.
I can mute myself too. Puniji, can you please try now?
How about now? So it's okay.
Now, to me, it's been clear. So, anybody with problem? No. So I think you're good to go,
Great.
Puniji.
So 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 we'll have that forum for people to discuss, and we'll just keep an eye on it. But largely, it's your forum on Moodle, and to discuss, answer each other, give resources, local. If some of you are from Southern California and you happen to have some resources, by all means do. And so one other resource that I want to give you is that if you want someone to connect to a counselor, you can go to Psychology Today website. They have a list of all the counselors and therapists that you can select nationwide via region, via specialty. That's where I send people to also. So, you can make use of that. Let's start our next class. And I know it's a lot of material. A lot of you have questions. If there are direct, specific questions that you have about someone you have in mind, by all means, WhatsApp me and I can, quickly let you know if you can access help through some agency. And we cannot solve everyone's problems. That's important to remember. And then kind of move forward. Let's start our next class and learn a little bit more about. There was a question about what is the example of open-ended questions. We'll talk about things like that now in our communication skills.
So should I start sharing?
Yes, please.
This slide you want to do later, or?
Yeah, we'll do it later. I think let's go to. Yeah.
So this is the communication skill.
So here the homework is, I hear an echo again from somewhere. It's not from me this time. So here the homework is so you use open-ended questions and write about your experience, just a small paragraph, who you used it with, what it was, and what was your experience, okay? All right, so great that Nan Kishorji has sent a link to Psychology Today website, great. So let's move on with our next slide. Okay, and then the next one. So we're going to talk a little bit more. We already touched upon this a little bit, that nonverbal communication, silences are part of counseling skills. Let's see. So first of all, when we are communicating with someone, as we said, we have to attend, give them our complete attention. Put away phone, put away knitting, crochet, what have you, and just kind of look at the person, make eye contact. Now, here with regards to eye contact, you may, take the culture into consideration. If you happen to be older person and you have a young person in front of you, and he's been raised in an Indian family, you may find that he or she may be a little bit reluctant to make eye contact with someone who's 20, 30, 40 years older, and sort of accept that and take it into account. Likewise, sometimes if it's um, a woman, say from a very traditional, perhaps different culture, or if you happen to be counseling a woman who is observing the parda system for whatever reason, she may be a little bit reluctant to make eye contact with a male counselor. Keeping within those limitations, by and large, good eye-to-eye contact, and attunement, like you kind of tune in to their demeanor, to their position, and if they're leaning back, you can lean back. If they're leaning forward, you can lean forward. If they speak in a certain tone of voice, you can sometimes, to some degree, tweak your voice to match theirs, right? And notice if there are any contradictions. Um, if there are, ask for clarification. It's okay to kind of say, I just want to clarify. There seems to be a little bit of a discrepancy here. You mentioned this happened a year ago, but a year ago you were not in the country. Something of that kind. And then watch out for touch. Sometimes a little bit of a pat on the shoulder is okay. Sometimes it's not. It varies a lot from person to person. Sometimes people might, you can imagine if you're meeting an older person, senior person, and they might say towards the end of the session, can I give you a hug? And you may decide that it's okay or not okay and respond accordingly. And it's fine, so long as there is permission and both parties are okay with it, it's fine. So, but just being very respectful about the kind of touch, and obviously very limited, very sort of short, kind of just with the intention of communicating your presence, your attention, your compassion, right? Like, for instance, someone's talking about the losses in their life, and you just reach out and touch the back of their hand just a little. That's okay, but you don't want to kind of exceed their boundaries, right? Then verbal communication, of course, we've already talked about. Again, very respectful, keeping it honest, respectful, genuine, including things that we are skilled at, whether it's storytelling or a little bit of humor. Try to avoid sarcasm. Sometimes people have difficulty differentiating sarcasm from humor. Sarcasm is actually something which is anger and wit combined, and it may not sit very well. So avoiding sarcasm, if it's just some kind of a light remark that can break the ice, get people sort of interacting more freely. One of the most difficult things, and I think Mukunji had mentioned this as well, to manage in our counseling session or compassionate presence session is managing silences. We are very uncomfortable with silences. It starts becoming, people become nervous if the client is silent. And then they might just go ahead and ask a second question or a third question or a fourth question. So before you know it, there's a barrage of questions and the client can get overwhelmed. So allowing that silence to be, because in that silence, the client may be processing things, maybe trying to figure out how to approach that, might be clarifying things within their own mind. So uh, allowing silences and getting comfortable with that. Next slide, please, Rajuji. Now let's look at some listening blocks. In the past few years, people have found this very helpful. And also things that we tend to do actually naturally at home. And you know, you might have some examples of how this actually transpires in your home. Advice giving, we know all this, right? So I mean, I think in the last session we had last year, someone was complaining about how as soon as she talks about something going wrong at work, then the husband will make suggestions about what she should or should not be doing. So before the listening has occurred, before validation has occurred, before empathy has occurred, there is advice giving, right? And then we do this all the time with our children as well. And and you know, we and who grew up in India are very patient with our parents giving us advice or our elders giving us advice. But here, the second generation Indian Americans, they will right away, you know, sort of intervene and get upset or even angry. Stop advising me, you know. So they don't take that very well, and it sort of ends the communication and closes the communication right away. And then parents sometimes, but isn't it my job to advise, you know, my children about this and such and such? It needs to be done in a more open communication manner in order if they really want it to sit well with the kids. So that's something that will need a little bit of work for most of us. Then directing, which is being do this, don't do this, go here, don't go there, being very direct. That's something, once again, which is very cultural for us, because ours is an authoritarian culture, an hierarchical culture, that people who are older or senior can give direct directions like that to the others. And it may be something that doesn't sit very well with the second generation Indian Americans or, you know, maybe other younger people. Warning, we do this a lot. If you don't study, you're going to fail. If you don't get good grades in SATs, you will never amount to anything. If you don't do such and such, you're going to lose your job. If you don't do this, you know, constant, or if you don't do this, then I even actually, it breaks my heart when someone recounted how the father told the 7-year-old son, if you don't do this, you're not my son. You're not going to be my son, right? So, or I'm going to disown, if you do that, I'm going to disown you. And they don't mean to disown a 7-year-old or a 9-year-old or a 13-year-old, but these are warnings. So the idea is that they can somehow scare the child into compliance. And it only does not end up in increasing compliance. It only ends up in increasing fear and anxiety in the young, right? So that's something to watch out for. Then something connected to that warning is making threats. If you do this, I will do that. And you know, women will say to me, you know, I have given him so many ultimatums. I'm like, you don't give so many ultimatums, right? You only give one. So never give ultimatums unless you're going to follow through on it. So that's the threat piece, to avoid giving ultimatums, because giving a threat does not help the situation. It does not improve communication or the relationship. So these are listening blocks. Chances are you're not going to do this with your client. You're more likely to do that at home, nevertheless. Then arguing or lecturing, that might be something to watch out for. We can sometimes get caught up in lecturing our clients. I have to say it comes naturally to some of us, and it's hard I mean, sometimes, you know, I have to apologize. Sorry, I think for the past 5 minutes I've just been lecturing, you know. So so it's kind of something to be mindful if it happens, to sort of step back. Another one is name calling and ridiculing. You're so stupid, you're a loser, you can't, you know, if you can't do this, then, you know, you're no good. So kind of keeping that in mind. Once again, we're not likely to do that with our clients, but we just might say something like, well, what a stupid thing to do, you know? So watch out for those words like stupid, loser, and things that are words that are sort of judgment words. Another thing that we are likely to do, even with our clients, is reassuring them. So, oh, don't worry, it'll be all right. And they might say, how's it going to be all right? I just lost my father. What is going to be all right about it, right? So, I lost my job. How's that going to be? You know, so kind of not entering reassuring too early in our interactions, and not asking people to get over something, but rather allowing them to have the space to talk about it, and then you kind of express empathy. Wow, what a difficult situation. I can't even imagine how difficult it might be. So then the other block is withdrawing, when you don't like something that someone has said or done, or you don't like the fact that your client has not necessarily followed through with some of the agreed upon suggestions in the past session. Then you just withdraw from that client. You know, I'm not going to work with you. You're not even doing this, right? It's tempting sometimes, especially if they haven't followed the suggestions, you know, session after session. But that's something you want to watch out for. Then shaming, trying to be mindful of not shaming them if they are not following through with your values. Uh, you know, whether it's drugs, or whether it's uh, you know, flippant relationships and quote unquote hookups. It's just watching out for those shaming values that sort of creep into our interactions, no matter how hard we try to not go there. Then humoring or distracting them. So while using a sense of humor is a good skill, but trying to humor someone who is upset or emotionally distraught as a way of distracting them from their emotion, not validating their emotion, that can feel like you're being dismissive. You know, you're not honoring their distress, you're dismissing it. And then the last one, this transference and countertransference. So this is something which to some extent may enter a counseling relationship, where you are counseling someone for a few sessions, when you are working with someone who's going through grief, or, you know, in the compassionate presence capacity. Then there is likely to be transference and countertransference. Um, Transference and countertransference are concepts that have been sort of talked about in traditional Western psychotherapy. And these are concepts that are supposed to be pivotal in bringing about a change in a client. Transference is how the client feels towards you, the way he might think of you. The relationship from someone else sort of gets transferred onto you. Let me explain it further. For instance, you know, I'm quoting here a client of mine, and she wanted to transfer. She and I had a good relationship. We had several sessions together, and it seemed like we were doing some good work. And then she wanted to transfer from me, so to another therapist. And when we asked her, she said, Dr. Mahendra is very nice, but she's so much like my auntie, and I don't feel comfortable sharing certain things with her. Right? So there, her relationship with her auntie is being transferred onto me as a therapist slash counselor. So this is transference when the counselor is being seen as someone that the person may have had in their life. Some other relationship is being transferred onto, and emotions connected to that being transferred onto therapist. Now, countertransference is the feelings that the client, that the therapist or the counselor might have towards the client. For instance, you may really, really like your client, and that's countertransference. You like them so much that you really want to help them, or you see this woman and she's going through domestic abuse, and your sister went through something similar. So now you see this woman as your sister, and you really, really want to help her because you perceive her as you did your sister. So that's countertransference. What might happen is that you would then be so very driven to help her that you may end up pushing her in a direction that she may not be ready for, right? So transference and countertransference are, on one hand, things to watch out for, but are also, on the other hand, the relationships and the emotions that can bring about a change in the client. Yeah? Okay, let's go on to the next. So now, talking about active listening, you'll see how this is being repeated again and again, from Mukunji's class to my first class, and now again here, respectful attending, and using open-ended questions and few questions. And I'm going to talk about this a little bit more. I know one of you asked about it. Managing silences, we already spoke about it. Staying focused, which means, kind of coming back to the topic at hand, whatever is going on in the room at that time, just staying with it, bringing the attention back to that again and again and again. Reflecting, this also I'd mentioned, whatever emotion you are sensing in the client, he might not even be aware of it. He might say, and this happened, and then they did this, and then they did that, and he's talking in an animated manner, and you see him sort of bouncing on the book that he's holding, or that's on the table. And you might say to him, wow, this has really upset you. Or this is, you sound so angry right now. And then he might, oh yeah, that's exactly how I feel. I feel really mad. So you see, they might not be in touch with their emotions, but you sense them, you see them in the space as you're interacting with them, and you reflect it back to them. And that allows them to have clarity about their own feelings and their own thoughts, right? Now, clarifying is when you ask for a clarification. I think I mentioned that. Wait a second, you mentioned that you had two sons, but then you had this girl's name. Oh yeah, that's my niece. She has come and she's been living with us for past year or so. So clarifications like that are perfectly fine. Paraphrasing is, as I mentioned, saying what they're saying, but in a different kind of way. So that allows them to know that you're listening and attending and can understand what they're saying. And it also confirms for you that, yes, you have indeed understood. Sometimes when you're paraphrasing, they might say, no, 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 that's not how it is. That's not what I meant. And that's fine, right? It's good that you made that effort. Now, summarizing is something after you say you ask someone, well, what brings you here? How may I help you? I'm a CHT counselor. How may I help you? And they go on and they tell a story for the first 10, 15 minutes and of their monologue. And at the end of the monologue, you kind of summarize it for them in, just, for instance, they might say about this happened. With my son, and then that happened, and then this happened, and then he did this, and all you can summarize it as, so you've been telling me that your son has been smoking marijuana for past 3 years, and you've really tried to help him, but he won't listen. That's all you've got to say, instead of then this happened, then that happened, then I took him there. There might be a lot of details, and you kind of give a summary comment that brings it all together. Right? When you do these things, when you reflect their emotions, when you clarify facts for them, when you paraphrase and summarize, and you do that while expressing full attention, this process itself, as they're speaking and as you clarify, this allows their thought processes to kind of get sorted out. They can sort of because inside our heads is a big jumble mumble. It's like everything is interconnected, and all thoughts are feeding to different thoughts and getting sort of all mushy and muddled. And speaking and then having someone reflect, paraphrase, summarize allows some a cleanup of our thoughts, so to speak, right? Okay, let's go on to, maybe please go on to that open-ended slide that sort of, even before this, I think one before. Yes. So what are open-ended questions? So open-ended questions, let's see what are closed-ended questions. Let me see. Suppose I come here and I ask you, why are you here? So you might say, well, I am here to attend a class, and that's it. There's no more about this. But if I was to ask someone, what brings you here? They might say, well, I was really interested in finding about counseling, and this was the opportunity I had, and I thought this was a good time to do that. So I might get a little bit more information. I may ask someone, if you ask someone why questions, you usually get one word response. If you ask someone, what's going on? Once again, you may get a brief response, or you might just hear them say nothing. However, when you ask open-ended questions, they will be more how questions. So, for instance, if a client walks in and you say to them, can I help you? They might say, maybe. Or can I help you? They might say, I hope so. And it stops at that. But if you were to ask them, how may I help you? They might have this has happened and I'm wondering if this could be done, and so on. So they will be offering you more information, right? So why questions and what questions are very often closed questions, because the closed questions are questions when the answer is 1 or 2 or 3 words or 1 or 2 sentences. Open-ended questions are questions that invite the person to share more. For instance, what brings you here? How may I help you? Instead of saying, are you feeling okay? So the other person is going to say, yes, I am, or yes, I'm not. But if you were to ask them, how are you feeling? And today they might have a little bit, Well, I'm okay, but I sort of feel a little low. So yes, Seemaji, the questions that I have up there are closed questions, right? So let's give it a, so closed questions means that the communication ends with a very quick response to that question. Open-ended questions are invite the other person to share more. So with this, let's see if we can convert some of these questions to open-ended questions. Are you feeling okay? Would someone like to kind of convert it to an open-ended question?
How are you feeling?
Okay, all right. That's a good one. I think we mentioned that. The other one, does your son listen to you? Now the response could be yes or no, right? And then that's the end to it. How would you convert it to an open-ended question?
How is your relationship with son?
Wonderful, wonderful. Is there a problem in your marriage?
How is your married life?
Okay, or what's your relationship like? Yeah, great. Is your father abusive?
How your father behaves with you? How your father behaves with you?
Yeah, not abuse so much, but what is the relationship between you and your dad like?
Oh.
Yeah, you can kind of play with it, make it something that the other person is likely to respond to. Can you come up with any other questions that might be a close-ended question that you think you might be using and you could now change? Anybody?
Well, with the kids, it's how was your day? Even though it's a how question, that usually comes back with fine.
Yes.
Okay.
Yeah, true. How can you change that to an open-ended?
Hey, did Mrs. Smith ended up doing that project today with you after all?
Great, great. Or
would you like to share something about today's activities?
No, they'll say no. No. Knowing the children, they'll say no. Right? Or they'll just nod their head in the negative. But you could say that, but really engaging with something that might happen during the day. Did that project go well? And did the other kids have a difficulty with that diorama that you were working on as well? So kind of that, well, so and so did, but so and so didn't. So that might encourage them to talk some more. Yeah. So it's some of them are simple and easy, and some of them require a little bit of thinking. So I want you to see if you can, in your home or in your work, if you can, check yourself when you're about to ask a close-ended question, convert it to an open-ended, and see the response you get. This has generally gone well as an exercise in the past 2 years. Let's see how it goes this year, okay? Let's try that out. So let's move along, Rajuji, to the slides. Where are we? I think, yeah, this is empathy. So we've talked about empathy a little bit. And in empathy, we want to try and take the other person's perspective, want to understand their emotion, and that requires us to become a little bit more aware of how they're feeling and to mirror their feelings and then express concern and desire to care for the individual in need, and then try to put yourself in their shoes and then maintain a non-judgment stand. That is empathy, to be able to take perspective, someone else's perspective without judgment, with the intention of wanting to help them feel better, or not, but at least to, you might not be able to make the other person feel better, but at least to have that perspective. Okay, next slide. So there's a difference between empathy and compassion. Empathy is when you are with the other person and you express that in interaction, in communication. Compassion is something that you can have for another person, even if that person is not there. You may feel compassionate towards a group of people. You may feel compassionate towards certain disadvantaged groups. So it's a positive quality, but different from empathy. Right? Let's move on to next. So I have just given some, like a lot of times in our communication, it becomes important to, instead of saying, I'm listening to you, paraphrasing it and summarizing it, right? Because that shows that you are listening. Instead of saying, I empathize with you, you can kind of express your empathy, right? And I've just given some statements how you might be able to do that. Of course, you do it in your own way. I'm so sorry you're going through this. It sounds like such a difficult decision. Boy, that was so disappointing. Or you can kind of express your own feelings as you listen to them. I can't even imagine the pain you're going through. I don't know what to say. It's fine to say, I don't know what to say. I wish I could make it better. I feel sad listening to you, to what you went through, right? And then, of course, as you attend, paraphrase, reflect, and then thank them for sharing. Thank you so much for sharing that with me. It's a privilege to hold that as in confidence. Yeah, things. Okay. Let's go on to the next slide. We're going to go over this. We don't have time for this. Let's go on to the next slide, please, Rajuji. Okay. So we've come to the last module of our class today. So there's this person, Daniel Goleman, who talked about emotional quotient. Has anyone heard about emotional quotient or emotional intelligence?
Yes.
Okay. Now, anybody else?
I have as well, Puniji. Yes.
Okay, all right. So some people are here, and I think some might not be. But anyway, so it really emotional quotient really requires. So they found Daniel Goleman. He found that a lot of people succeeded at work not because they were the brightest or they had the best credentials, but because they knew how to navigate through their relationships. And in order to navigate through their relationships, and not by, not relationship in the sense of networking or getting to know the boss and so on, but in a different kind of a way, managing their team through an emotionally savvy strategy. And they found that people who were a little bit more aware of both their own emotions as well as others, and those who were able to manage their emotions so that they are not sort of given to impulsive sharing or impulsive outbursts of their emotions, and those who were not reactive when they felt some strong emotions, that they were better leaders and managers. So what's important in emotional intelligence is awareness of one's emotions, thoughts, feelings, and how our own thoughts and feelings are affecting others. How does our anger affect others? How does our being sad affect others? How does our anxiety affect others? Kind of being aware of that, because very often We are not aware of anything. We are not aware of our depression, anxiety, anger, and we don't even care a damn about how it affects anyone else. Because if we can possibly be aware of our own emotion, that in itself is a big thing, and we don't know what to do with it. And how can we possibly worry about the effect it's going to have on someone else? That's beyond us. So getting to that place where we not only are we aware of our emotions, but we are also aware of the influence or the effect that our emotions have on other people. That is part of being emotionally intelligent. And then self-regulation of our emotions. We are able to soothe ourselves when we are anxious or angry, and therefore manage impulses and not be reactive, right? And having an internal motivation, feeling passionate about what you're doing or the communication that you're having, or the interaction that you're having. And being able to take other people's perspectives, see where they are at, and being able to validate that and express that. And then also treating others with respect, with politeness, and with a sense of friendship. So very different from the authoritarian hierarchical approach that we used to have way back when the management system was very sort of where the very authoritarian. Now it's kind of more, even if they are your seniors, you expect a certain amount of respect and a certain way of managing interactions, a certain way of giving you feedback, not yelling at you and throwing the file across the room, which is something that used to happen probably 30, 40 years back. Every once in a while it still does, and then that's cause for harassment, right? So let's go on to the next slide. So an emotionally intelligent person is aware of one's own emotions, managing it, has sensitivity to emotional signals from within themselves, reduces reactivity, impulsive actions, maintains and enhances relationship, and listens actively, and is compassionate towards others. And that allows for a good relationship, especially at workplace, but also home, also with the clients. Next slide, Rajaji. Okay. So how do we go about building emotional intelligence? First and foremost, recognizing emotions and labeling them. So they say that there are 4 main emotions: happy, sad, angry, and happy, sad, angry was the 4th one.
Jealous?
No.
Excited?
Anger?
Did I not say anger? I thought I said anger. Happy,
Yes.
sad, angry, and one more. Okay.
You did.
Excitement?
No, excitement would be a shade of happiness. Sarcasm.
Jealousy?
It's fear.
It may well be anxiety, sadness, anger.
It'll be
Fear?
Fear.
Fear, that's right. Yes, thank you, Ramya. Fear is the other one. So you may have others are really just shades of these, right? So recognizing them and labeling them, because so often we are not aware of our emotions. We don't, for instance, a lot of women in domestic violence situation might not even be aware of the anger. The depression is just, and anxiety is completely suppressing the anger, which is there, but it's just completely been suppressed. So recognizing those, then expressing them in a reasonable manner. Now, expressing emotions, some people feel that, oh, expressing emotions is good. So I can yell and scream and be angry, because isn't that what we're supposed to do? Express emotions? Not really. Anger is one emotion which, when you express it, it actually increases. So expressing anger by letting it out is not the best way to handle it. It can be processed, but in a different way, okay? And then acknowledging those emotions in others, understanding why a person might be feeling a certain way, understanding what might be the motivation behind their behavior, and then learning to tolerate the distress. I think a lot of times, and sometimes, we might have some discomfort in our tummy, whether it's a feeling or whether it's a question or whether it's something that's unsettling. And then we feel we just have to ask there and then, or we just have to bring it out or comment there and then. And being able to hold that unresolved question, emotion, or discomfort in our belly, let it sit there till it's an appropriate time to ask, and be able to process it and soothe ourselves if indeed that emotion is uncomfortable and we're not able to resolve it, is part of emotional regulation, part of distress tolerance. So being able to tolerate that distress is actually helpful. Being able to, it's sort of like for a child to learn how to soothe himself or herself without the parent jumping in to take care of the child each time is a good skill to have, right? So that's something to remember, that being able to soothe yourself is an important skill. And so even for your clients, being able to soothe themselves is an important skill. So you don't have to jump in and fix it for them each time, right? And then, of course, responding rather than reacting. That's part of emotional intelligence. And it's also something that improves as we become more mindful of ourselves and others and the situation. And we'll be talking about mindfulness down the road, and then we'll talk about that. So I think there's a raised hand. Ramya, you may ask, but I may or may not respond. Tell me.
I'm not asking a question this time. I just want to give a perspective that will be useful for us as Hindus, is that Hindu dharma itself defines emotions into 9 folds called Navarasa, and Nava signifies 9, as some of us will know. And we actually have Shringara for love or beauty, Hasya for laughter, Karuna for sorrow, Raudra for anger, and Veera for like courage, Bhayanaka for fear, and Bibhatsya for disgust, Adbhuta for wonder or surprise, and Shanta for tranquility. So, and I want to just weave in the fact that our traditions, Hindu traditions like Navaratri, which comes 4 times in a year, with the Navaratri that we just passed being the most important part of the entire year of Navaratris. And all of these are not just rituals, right? They're all tied to these emotions. These 9 nights are tied to these 9 emotions for us to actually introspect, sit with them. That's why we have all these samskaras of like fasting and like, sometimes I think there's a disconnect between what these rituals actually meant. They actually meant all about self-management. So when we talk about collectivist culture, I want to give this spin. Because of a millennia of colonization in India, we have become acculturated a lot. And most of us tend to be only cultural or rubber stamp Hindus, and we're not really truly dharmic Hindus. Every one of us in different stage, be it as a family or as an individual. So I feel like it's important when we talk about Indians or Hindus as collectivist culture, it's important to note that the acculturated part brought in a lot of adverse collectivism also into some family systems, because it's like a survival mechanism for us. We put in a lot of structure with norms into our family system to safeguard a lot of our faith, the indigeneity of us and the women. And it's important to note that we have adhikara, which is actually the individualism. So our shastras, from whatever little I understand, actually teaches us to be collectivist and individualistic in a coexistence, coexisting manner. And most of us are just doing a garvapsi to try to get to that point of equilibrium, is my belief. Thank you.
You said it so well, and thank you for, no, it makes total sense, all those 9 days of Navratri. I think next year Ramya is going to teach this class instead of me, because because that would be good to hear from you, Ramya. That would be wonderful. No, it's great. I think that's wonderful to bring it in. And I'm so glad that you did, because I don't know some of those things about our own shastras, but as you said, that we have missed some of that stuff, and it's been we've lost it, and we've kind of giving lip service. That's wonderful. Thank you for bringing it out here. Very pertinent.
Sonia ji has a question.
Yeah.
My question is less insightful, but going back to the when you talked about paraphrasing.
Yeah.
So it's one thing, if someone says, "Oh, you didn't get that quite right," that's not exactly it. But I also would imagine that there might be some defensiveness that happens, because it's one thing to say that something in your head, one thing to say it out loud and have it paraphrased back to you. If someone gets defensive, is there a way to, any ideas you can tell us on how to de-escalate that in a certain way?
No, you just say, "Oh, sorry, my bad. I didn't get it right, and thank you for clarifying." That's it.
Okay. Thank you.
I know there are lots of comments in the chat, so if there are anything that any questions, because I couldn't keep a tab on that. Anything? I think we have a few minutes, right? Rajuji, do we have a few minutes? Not quite.
No, we already passed 10 minutes more.
You have time. Time is not an issue at all.
Okay. So as I said, you can ask me, you can send me a question on WhatsApp if you have anything you'd like to know. And there is this forum. And thank you for listening. And I think some of the material gets so much, it gets a little dry. Thank you for just hanging in.
Can you
And
put the question again?
Yeah. Who's that?
Can you put the question again, please?
Which question?
Homework question.
They are in the Moodle.
It's in the Moodle. Okay.
Yeah. Homework questions are in the Moodle, because you'll see this whole, all the slides are in the Moodle, and each presentation has objectives. The first slide before the presentation begins, and right at the very bottom is the homework question.
No problem. Thank you.
Okay.
Thank you.
Yeah. Wonderful. Well, thank you for letting me.
Yeah, Puneetji, very good session. This can be
It was
useful
very
in
nice.
day-to-day life also.
Yes.
Not just for anyone to be a counselor, but very practical. Whatever you explained is very practical and can be useful.
Yeah, thank you, Puneet ji. And now I will request Kailash ji to take over the floor and talk about next session and about Arjun ji.
Thank you. Thank you, Nandkishore ji. Thank you, Puneet ji, for an excellent session. I think, Ramya ji, that addition you brought in is very relevant to us. So we will have to talk about that for future plans. We have to put that complement in our presentations, like Puneet ji also suggested. Everybody okay without a break, or should we take a 5 minutes? No, I think we just continue. We are more than halfway through here. All right. Okay, so the next session, the last segment for this fourth Sunday is the topic of ethics and conduct. And I am very happy to introduce to you Arjun Rangarajan. He just joined us. He is a young successful attorney in Silicon Valley, and he has been a supporter of HCI with some pro bono work he did. That's how he got introduced. He's a good friend, and he is going to join me. So I will kind of bring the governance perspective or the business, my business experience in life, and he brings the legal and the whole aspect of regulatory requirements that go into our thinking, into our behavior, and into our conduct as human beings. That's what we do. We think and we behave and we act on different things. And what made civilization happen is that rules were formed for what you will do and what you will not do. And for some you can get away, for some you can get away with a slap on the hand, and for some you end up going to jail. So this is a series of things that we live by. So the whole question of code of ethics is basically ethics are moral principles that govern one's behavior or the behavior of an organization or the conduct of any activities on the part of individuals or organizations. So that is the basic kind of that's like say, look, our organization will always be fair and respectful. That's all the ethical part may say. But the rubber meets the road. It has to say, how do you treat individuals? How do you deal with non-discrimination? How do you deal with equality? How do you deal with fairness? All those are derived from that basic ethical principle. So we're going to go through in the next 45 minutes, a sort of a broad kind of a checklist items and some discussion. I'll give you a brief overview of organizational kind of a code of conduct. And in the context of the nonprofit like HCI, how do we manage HCI? What are the things? And then you being part of HCI, you get a perspective on it. And most of this actually happens to be pretty common sense when you think about it. That's how we were raised. We've lived through those rules and boundaries. But it's good to refresh ourselves and also understand the logic behind some of those. So I think with that, if we can go and Arjun, you will come back, and then you can talk after I finish a couple of slides.
Definitely. Yeah, thank you.
Thanks. Thank you very much for again joining us. Okay, Nandkishorji, please put the slide up for me.
Yeah.
And I want to go to the learning objectives and also the question. Yeah, so what happened to the other slides?
In the first one.
Maybe it comes after this, right?
This is the second slide.
Okay, or the third slide. My gray. Oh, here it is. I want to show this first. So this is basically we're saying this particular segment will provide the ethical principles and rules for in-person as well as virtual service. So it doesn't matter whether you're in person sitting across or doing it over Zoom to somebody. Two of us are going to cover this section. And basically, we want to be able to convey to you the basic code of conduct of nonprofit organizations, and then understand the various aspects of conduct on the part of individual volunteers, counselors, and the homework, by the way, very appropriately, that I think we already touched on, is what ethical principles do you see as being a challenge working with the Indian community? And I think we know about the concept of privacy, how emotions come in, how free advice comes in, all those things that we are so much accustomed to. They have to be brought into the right perspective and you begin to do the counseling kind of a relationship with people. So that will be the homework. So you can be vigilant as we go forward. Okay, next slide, please. I think I just touched on the code of ethics and code of conduct are basically the standards that an organization or individuals must adhere to so as to maintain the viability of an organization or their association with the organization. A code of ethics is a set of principles which influence the judgment, fairness, respect, transparency, and then code of conduct, of course, is derived from the ethical codes, and they set the guidelines that influence individual actions, compliance and rules, no discrimination, job performance, etc. So that's basically kind of highlight. So I'm going to go, rubber meets the road is the code of conduct. So we're going to go step into that one. And I'll go through what are the code of ethics and the code of conduct that are applicable to non-profit organization. Okay. So I think the first one is that the personal and the professional integrity of all associates with that organization is number one. It is the staff, the board members, the volunteers, everyone, and they have integrity, transparency in their dealings with each other and as representative of the organization. And the organization promotes a working environment that values respect, fairness, integrity, and collaboration. Very basic, but easier said than done. And so it requires regular reminders, training, vigilance, and all those things. Second one is to support the mission, because this organization has been put in place with a specific mission in mind. And so, and that mission, by the way, is derived back to the board, the shareholders, the donors, whoever created this idea of an organization. And so that all the programs must support the mission, and that there is a consistency and it is well understood that it is a finely aligned organization in terms of its workings, its functions. The third code of conduct is governance and accountability. And governance ultimately boils down to a board of directors that really governs. And then the board of directors, by the way, relates to the shareholders, the stakeholders, whoever owns this organization. And so they set the mission in place, the strategic direction of the organization, and policies and practices. So that is the third one. So the integrity, supporting the mission, governance, and accountability. Fourth one is legal compliance. This is what keeps you from going to jail. They are knowledgeable of all and comply with all the laws, regulations, and international conventions. So that is again, and this all comes down to management and governance. Next page, please. I think we missed the sequence here. Nankishorji. We are back to Punitji's chart. Hello.
Let me check what happened.
Something some wrong button got pushed.
Yeah. No, it was more press, so I think it. We finished this one. This
the
one.
first one.
This one. This is the right one, right?
No, I'm not seeing that. I'm seeing open-ended questions.
Yeah, that's for Punitji's.
Oh. Okay, 1 minute. Let me stop sharing and share it again.
Yeah, reshare, that's fine. You can take time, not a problem. Yeah,
So let us go now.
Okay, good, right there. Yep. So the next one is financial stewardship. That means the managed funds, whatever funds and budgets are managed responsibly and prudently. Transparency and disclosure, again, as the words imply, that they maintain, a view of public, all and the stakeholders in terms of what is happening, and the organizational financial matters are also reported properly. Program evaluation, regularly, you measure them, what's happening, and they're effective, and so on and so forth. Inclusiveness and diversity. I think it has been always talked about. It has been always on the books. Unfortunately, it has not been followed as rigorously as it was intended to be. I think in the last couple of years, you have seen in the US particularly, there's big awareness of a need for more true diversity, true inclusiveness, and that goes into gender bias and all the racial and ethical and LGBT and all those things that have been coming up. I think we are making progress, but that is a big open area for most organizations to be very cognizant of and be working on those. And then finally, fundraising, which is a big part of any nonprofit because you need to have the fuel in the tank. And for that, you have to have the donors have a right of disclosure and influence that to the degree that you agree with them, and including periodic reporting. So these are fundamentally things that we as a nonprofit organization follow in our own conduct, in our own operations and so forth, even though we're small, but that does not change the spectrum of the conduct items that we talked about. Next. So at this point, I'm going to now bring in Arjunji, and he's going to talk about how do you begin in terms of a volunteer or a counselor, whatever capacity, where do you begin to look at the conduct? And the first one, of course, being the looking at what are your duties towards the people being served. So Arjunji, please come on and participate in this discussion.
Yes, thank you, Kailashji. Thank you for the introduction and for the very kind words in the beginning. I find it a little ironic that a lawyer should come and talk about ethics to a group of religious people. I think it should be the other way around, but I'm happy to do this and talk about some of the parallels, specifically in terms of the relationship between a client and someone who's serving their client. And there are interesting parallels and things to learn from an attorney-client relationship. And just to be clear, this is I'm not providing legal advice here or talking on behalf of anyone. It's just an independent thought. But if there are questions that as the counselors or anyone thinks that has a legal implication, I would encourage you to reach out to HCI leadership to discuss the specific scenario. But for now, what we'll do is we'll talk about the duties and the relationships between a client and a service provider. And first of all, what's important is to define the scope of this relationship. We see several relationships of trust in our day-to-day life. We see an attorney-client relationship. We see a doctor-patient relationship. We see an accountant and client relationship, and so on. And what defines a lot of these, even a guardian-child relationship, and what defines a lot of these is the position of trust that one party is placed in. And we'll go a little bit further into this in terms of fiduciary duties as well. So there are certain principles guiding these relationships. A lot of these are based on common sense. You clearly know that one person is reliant on the other person, and based on this relationship, there are certain principles to keep in mind. So the first one is understanding and defining the role. The volunteer or the counselor must understand their role, limits, and obligations. And there may be various points at which this needs to be communicated clearly to the client. And you see communication as one of the bullets here, and I can give this as an example. I can give an example from my own life as an attorney, where I was counseling a pro bono client specifically on a certain immigration matter, for example, right? And because of the nature of the relationship, the client assumes that you are their counselor for everything. And so whatever trouble they get into, the relationship might grow to a point where the first instinct is for them to call you because you're the only trusted person they know. And it is fine. It is fine for the relationship to get close, but it's important to understand and explain to the client what is the scope, what are the things I'm going to help you with, what are the things where you need to reach out elsewhere for help, and to keep that line of communication open is very important. Loyalty, a volunteer must be absolutely loyal to the client. This is similar to, again, an attorney relationship where an attorney is a zealous advocate for the welfare of the client. Similarly, keep the welfare of the client of utmost importance. Very important to keep that in mind. And finally, respecting a client's decision. The volunteer must accept a client's power to make the final decision on an issue. This is very similar to an attorney's code of ethics, where there are certain aspects where, attorneys act as agents of their clients, and this is not always true in a counselor situation. So what becomes important here is there are certain very minor decisions that attorneys can make on behalf of their clients, but there are certain decisions that are clearly out of scope. For example, if whether to testify in a criminal trial, whether to settle a litigation, these are clearly demarcated as decisions to be made by the client. And in a counselor situation, there's not even the agent relationship. So you have to keep in mind that all of the important decisions, in fact, all of the decisions are eventually the clients. There are recommendations, there are strong recommendations, there are suggestions, but at the end of the day, it's the client's decision to make. And that's an important thing to keep in mind. And we can go on to the next slide. I think again, we lost, we lost the continuity.
Yeah, there's some kind of a shuffling going on here between slides.
Yeah. Are the screens getting switched?
I think what happened, stop share. Let me start again. So we came again.
Okay, we can go back.
Keep going backward.
Yeah, oh, forward.
There.
One more forward.
Next one.
Yes, yeah, that's the one. Great, thank you. So privacy and confidentiality. This is of utmost importance in any relationship of trust, and it's one where I'm sorry I missed the first portion, but there are cultural implications as well to confidentiality and privacy, because different cultures may have different attitudes towards what is confidential or what might be expected to be kept confidential. This again is important to remember, that professionals have a very serious responsibility of confidentiality to their clients. Why is this important? Because that's what keeps not only the relationship in that specific scenario going, but for that entire profession as a whole. If lawyers started breaching the trust of their clients, if doctors started breaching the trust confidentiality of their patients, the entire profession falls into disrepute, and that's why it's very important to keep in mind that your clients are sharing information assuming confidentiality, and it's very important to keep this in mind. And a lot of times it's not on purpose that there is a breach. It's a lot of times it's inadvertent. So it's important to think about this a priori before anything can go wrong. Any notes that are taken, any calls that are attended to, and we think about this all the time as attorneys, especially in a work from home scenario where previously we used to have our offices and calls to the clients were clearly confidential. In a work from home scenario, you're answering calls, and you have to be mindful of people around you, where you're taking notes, where are you leaving information about this. It might easily, other family members or friends might have access to it, especially in an electronic situation. Is it a shared computer? Is it a shared iPad? What steps have you been thinking of to keep information confidential and private? You have to keep that in mind. historically, if you look at some of these well-known relationships, such as attorney-client or a doctor-patient, the legal system affords certain kinds of privileges in the sense that in order to encourage full and fair communication between an attorney and his or her client, the discussions are privileged, or in other words, they can the holder of the privilege can prevent that information from coming out in court when there's litigation going on, for example. And those are specific situations that society has thought of as important and has afforded these privileges. There might be other privileges afforded in other situations that varies on a case-by-case basis, but whether there's such a privilege afforded or not, confidentiality is an important part of trust. So for example, it would be a good idea to inform any client you're working with that you will keep private information confidential to the extent that it's allowed by law. Of course, the exception here is there are certain situations where you may not be allowed to keep information confidential. If there is ongoing threat to physical harm, if there's abuse that needs to be disclosed by law, then those are situations, of course, where it would have to be done. But at the outset, it might be a good idea to tell the client, hey, of course, you can expect me to keep this confidential, other than situations where it's required by law to disclose it. And what are examples of confidential information? Family relations, mental states, mental conditions, financial information, health information, social issues, and so on. One of the things that people tend to assume is not confidential is anything that's available on the internet, for example, right? You say, well, I did not think that this was confidential because this information is easily available on the internet. You could easily look up their address, or you can search them and find their address or phone number or whatever. But that's no excuse for not maintaining confidentiality in this context. I think when certain information is disclosed to you in the context of the relationship, you should not think of, okay, is it possible for someone to look this up through other ways, and hence it's better to assume that information, phone numbers, relationships, ongoing situations, divorces, or whatever, whether it could be found to be public or not, it's important for the purposes of your relationship to keep that information confidential. Okay, I think we can move on to the next slide. So we can turn to certain privacy laws to help us guide through privacy issues. This is, again, not to say that these privacy laws are applicable in the specific context. That's a legal determination that we're not making here. But what they can do is, especially health privacy laws or privacy laws from Europe, which are pretty stringent, they give you guidelines for what are the principles, some of the basic principles guiding these privacy laws, and can we try to adhere to them so that even in the most, if we can comply with the most stringent case, that means we're doing a pretty good job of maintaining privacy. And to do that, we can look at, for example, a couple of privacy laws. The HIPAA, this is a law you might have heard of in other contexts, Health Insurance Portability and Accountability Act, and it was passed in the 90s, and it has with it, there are only certain covered entities for this law. But I think what's important, we're not going to do an analysis of HIPAA, but some of the guiding principles that come out of these laws are elements of fairness, transparency, consent, and limitations on use. So let's take a few of these concepts, for example. Limitations on use. So when somebody gives you information, they intend for it to be used in a certain way. And just because you got that information, it doesn't mean it's possible to use it outside the scope of what the disclosing person gave it to you for. And while doing this analysis, think about what is the scope of disclosure. Why do you think they gave you this information, and stay within that. If there's any doubt at all, even if you're thinking about the interests of your client alone, if there's any doubt at all, reach out back to the client to get clear consent. Tell them what else you might want to do. Do you even want to go go searching for it, ask someone else for information on this, any of that, reach out to the client for consent. So that brings us to the next guiding principle, which is consent. And if you look at all of the privacy laws, that's one of the guiding principles they mention. And when personal data is disclosed in any context, it's pretty clear before obtaining the personal data to disclose to the user, or in this case the client, what might be the potential uses of that personal data, and to be as clear and concise as possible while doing that, and then use it within the scope. And whenever the scope changes, reach out again to the client to ask for permission before using it in any other context. And if you look at the basic components, as I mentioned on healthcare privacy laws, you think of protecting individually identifiable information, health information, managing and securing them through electronic records. And again, that's a thing I touched upon earlier. If you're storing it in electronic media, laptops or iPads or phones that is shared with your family, think about how you're protecting this. Is there a way to demarcate a client folder and keep that specifically password protected so that other people cannot have access to it? And otherwise it may lead to an incident where it can get out. It can be completely inadvertent, but that's not an excuse. So keep thinking about how secure and private any information stored is, and that's pretty important. And there are penalties for violations. Obviously, in a government context, there are enforcers. There are certain government regulatory bodies that are given the authority to go enforce these privacy laws. That, for example, there can be the California privacy, and then the California Attorney General can CCPA can be enforced by the California Attorney General, and so on. So there's enforcement, and if we look at the parallel here, the HCI board or they can take up the responsibility of figuring out whether there's good compliance, and then addressing cases where they think there was a lapse of judgment to see what else can be done to make things more secure. So let's move on to the next page. Okay, conflicts of interest. So conflicts of interest. So what is a conflict of interest? Conflicts of interest can arise when there is a misalignment in terms of what is good between the interest of your client and the counselor, right? So am I always acting on behalf of my client? And a lot of times you see, and this is true for an attorney-client relationships as well, that the interests are aligned. When the client does well, you do well. But that may not always be true. There could be situations, and one of the important things is to spot situations where there is a misalignment, and it may not always be easy to spot. And the way to do this is to keep thinking about, so what are the interests of the client? Are they aligned with my interests? Is there a situation where it's possible? And here's where you need to think of two things: an actual conflict of interest and an apparent conflict of interest. So an apparent conflict of interest is the appearance to a third party that there is a conflict of interest, even though you personally might not think that there is a conflict. You may personally think that you're putting your client ahead of everything else, and you're acting in the best interest of the client. But for somebody looking at it from outside, does it look like you're acting on behalf of the client or not? If it does not, then you may want to stop and revisit whether it is in the best interest to act to keep that relationship going. So if you look at the definition, the legal definition, it says counseling of one or more clients may be materially limited by the volunteer's responsibilities to an other client, to a former client, to a third person, or by a personal interest of the volunteer, right? So could it be true that doing a certain action in a case may be considered acting in your interest rather than in the client's interest. In those situations, it's time to stop and think. And what can they do? Conflicts of interest can present major risk factors in providing the service, and just like breach of trust, these things can easily impact the reputation of HCI or its volunteers if people start thinking that there is a misalignment of interest here, or what they're doing, what is best for the institute rather than for what is best for the client. And in these situations, here are some examples: financial transactions with clients, do not accept compensation, do not pledge funds without authorization, and do not engage in inappropriate social relationships with clients. When any of this happens, it's important to stop and revisit the relationship. If there is any of these situations, you're encouraged to reaching out to HCI. Okay, let's move on to this is the fiduciaries. Oh, so let me,
yeah.
What are fiduciary? Who are fiduciaries? They're again special relationships of trust. And what are some of the examples? The most common example is a trustee who's acting on behalf of a beneficiary. There are other fiduciary relationships. There could be an attorney-client fiduciary relationship, a guardian-child fiduciary relationship, a board of directors and shareholders. What are you doing? You're putting your interest ahead of, you're putting your client's interest ahead of your own with the duty to preserve good faith and trust. And what happens in a lot of these relationships is that the client is not in a position either to understand or closely observe what you're doing for them and to keep a close eye and think, hey, why are you doing this? Or to closely direct the behavior of the service provider. They're just trusting the service provider. Think of a child and a guardian. They're just saying, okay, I just trust the child. The child is a minor. They just trust that the guardian is going to do whatever is best for them. And when you're in these kinds of situations, it's of utmost importance to put their interest ahead of your own. And the legal profession, again, to draw the parallel, it involves a qualified professional serving the client's interest with absolute devotion and fidelity to the client's interest. And whenever there is a doubt in this, the attorney is required to identify it and then withdraw if there is any potential conflict of interest or failure to act as a fiduciary. And in some of these situations, for example, in the trustee beneficiary or a guardian child situation, the law does require this fiduciary duty, and the person of trust can be sued if it turns out that they did not act in the best interest of the client. So it's a very important relationship, and it's important to consider a counselor or volunteer relationship in this fashion and think of putting the client's interest above your own, and when there is any doubt, to raise that and to potentially withdraw from the relationship if that's indeed true. Let's go on to the next one. I can briefly touch on these two slides, Kailashji, but I will probably let you again speak on this if you so desire as HCI.
Touch on this one, and I can then wrap up with the last checklist items.
Sounds good. So the HCI ambassador. So always remember that you're acting on behalf of HCI. HCI seeking to be a model service organization. This is new territory. Kailashji and everyone's doing great work, and the brand always follows you. So each member is an important ambassador to the communities that HCI serves. And individual conduct and adherence will reflect on HCI and impact its mission, and lapses in obligations can do pretty significant damage. And the damage can be both to the client and to the institute. So these are important relationships, and it's important to keep that in mind and keep your eye out for ethical issues. And a lot of this is a matter of common sense. If you stop to think about it, and this is how we operate as attorneys as well. We're kind of trained to identify situations where which are confusing, or where you're not sure how to proceed ethically. And the important thing is to stop and then reach out to someone who can help you out in these situations. And as attorneys, we're told who that people are. And whenever we're in a situation where we're not sure morally or ethically what the right thing to do is, we go talk to them and get information on that. So that's the ambassador role. And let's move on to the next slide, which is
the take home.
The take home rules. And yeah, Kailash, did you want to jump back in on?
I can, and then you can chime in, of course. But thank you very much for. You're so busy, but we appreciate you.
Happy to
joining us and giving us your perspective. That adds extra value because of your live experiences and all the perspectives you bring in. I think this basically common sense is probably the best way. We have our classes, professionals, highly educated people. So we are basically going through this like we do for all the 24 Sundays. We take some significant segments of knowledge, practices that will help them become, of course, develop them as individuals, of course. They're always learning new things, but also make you a very effective counselor serving the community. And the more sophisticated and the more informed you are, the better off you are. And this whole code of conduct actually has both the sides to it. You know, you make a big mistake, and mistakes happen because of greed or ego or emotions or ignorance. I think there's 3 or 4 scenarios where one can be doing things that they're not supposed to do. And it happens, unfortunately, you know, all the time. But the more cognizant of you are of the requirements, both the moral, the legal requirements, the more you serve. But the plus side is excellence comes from the collective behavior of all of us who are trying to build this institution or any other for that matter, that the more we are adherent to these basic moral and ethical codes, the better we are serving the institution and the community at large. So in just a ticky mark very quickly, I think that understanding the roles and the limit of responsibilities, and Punitji very eloquently talked about that in a very repeatedly actually through her lecture, which is, you know, we are not clinicians. We are only getting 24 Sunday worth of orientation on learning to serve. We're not becoming counselors in the clinical sense or areas. So we want to be very clear on where we don't want to go, because that can be problematic for everybody, the receiver and the giver and the institution itself. So knowing the limits of your role and the responsibility is very important. Privacy, I think, cannot be overemphasized. And as we talk about the ethnic and cultural background as Indo-Americans, particularly those born in India and live in the joint family situation where everybody's business was everybody's business, that kind of thing. You know, the concept of privacy was kind of alien. Well, that doesn't apply, you know, in this diaspora, in this society what we live in, even in India probably today. Disclosing information without consent of the client, no. And only when it's necessary. The narrowness of how you disclose, when you disclose with the consent, that's very important. Even with the consent, you cannot go broad banding things. I think the record, any written records and so on, electronic records, access of those should be controlled properly. That, like Arjunji talked about a few times on that. Harassment, of course, I think this is fundamentally a absolute no-no of any kind. It comes in so many varieties with us as human beings. When we look at another human being, a different kind of behavioral things are triggered, and the harassment is absolutely a no-no. In any circumstances that, as we always talk about, respecting everyone. You know, I think the golden rule, you know, in HCI, we call everybody a G. Even a 15-year-old volunteer has to be referred to, as Gauravji said, middle name is G. We did that very deliberately in the very beginning of founding of HCI. We wanted total equality, total, kind of a comfort in people belonging and participating and sharing. equality between faculty and scholars, equality between who serve us and everybody. So that I think is a very important rule to follow both inside and outside. Compensation, we had this our Dr. Bhatt, who was our first dean, not as Bhatt, he's kind of a, he said, you know, you go to somebody's house to give them some advice, and they have a big apricot tree, and they fill a big bag of apricots and say, okay, thank you for coming. Here is a bag of apricots for you. He said, should you take them or not? And that's a, I kind of think that's a kind of cute example. I said, yeah, a few apricots, I wouldn't mind, you know, but to take a couple of bags full, that's a bit much for, you know, for what, so you have to separate the two, you know. Cash compensation and gifts, I think, are a no-no. Abnormal and unusual circumstances. And for reporting, by the way, I think somebody mentioned HCI, as long as you're affiliated with HCI, you call one of us, the faculty or the board or any one of us, and say, by the way, I'm seeing this situation. I'd like to get some advice, and we'll be able to come back and react to that. Not commit any funds on behalf of HCI, of course, without, I think this other last item is what the homework is all about. It's going to be remaining sensitive to ethnic and cultural informalities, things that we casually do, you know, as a counselor, that I think they changes, and that perspective is very important to have. So why don't we just stop here for an open floor, questions to any one of us on this particular topic, and then we go to the. We have a lot of time yet, so we're not rushed for time. Please go ahead.
Yeah, so anybody has any question, raise your hand and we'll follow the order.
I think there were some questions that have come up on chat.
Let us look at them.
Yeah, there are several.
I think there's a question on emails and how to manage and secure the records when sent electronically. I think again with emails, I mean I would say, Anjanaji, the guiding thing is, especially these days, I think there's a lot of email clients that tend to remember the login. So anybody who has access to the device there is a chance that people can read emails. So it is important to not keep if you're discussing confidential information, to not have that automatic sign in, especially if the device is shared. Having a password protected device for this purpose can be pretty useful.
One call, do we have any written documents that we need when we are taking consent of the client? No, we don't have it, but I think in the we call the field operating manual, which will be by Mangala ji is going to cover that in the next session. We will go through that, and then you can deal with that question at that time. But we have reasonably good documentation scheme for us to utilize.
Yeah, and Simaji said that I think for our roles, we should avoid seeing the health records. It may not be required.
By the way, no. You do not want to touch. You do not want to touch anybody's health clinical records. That is none of our business. We are not trained clinical counselors or medical experts. We are not. Unless you happen to have a practice as an MD, like some of our CHTs are MDs, that is fine. As an MD, they can do their job, whatever they're doing, but not as a CHT counselor, no.
Yeah, and there is a question from Ashwarthi ji that if we need advice or to discuss clients with senior volunteers, more experienced volunteers at HCI, will that be disclosing confidential information?
Say it again. I couldn't get that.
I mean, if we want to get advice or discuss client situation with senior volunteers at HCI, will that be disclosing confidential information?
No, no, by the way, so you will not disclose the name of the client. So that's what, again, FOM will tell you that the individual name and particulars should not be disclosed to anyone other than the established process. The client should also know what the rules of the game are. Is that clear? So you will have, for example, you will have a mentor at HCI. You call the mentor and say, I have a 45-year-old female having this kind of a bigger issue. What do I do with it? But he's not going to say the name and address and telephone number, whatever has been given to him or her. That has to be maintained at that level. So again, the FOM will deal with that scenario also.
Yeah, then another question that is there a specific place where we can make documentation?
Make document?
Documentation for the client, right?
That again, FOM will tell you.
Yeah,
You are
okay.
not practicing, you are still fourth Sunday of a program of 24 Sundays. So you're going to get more and more. So this is basically to give you a very big perspective on the significant things that are into this mix of how do you become a successful community volunteer, counselor, and so on and so forth. But
And Ramayaji has a question. Ramayaji, could you ask your question?
Sure. So I'm in the field of psychotherapy, as mentioned. I'm in the process of acquiring my licensure for LMFT and LPCC. And in that capacity, as a therapist at this point who is working with clients, I'm a mandated reporter. That is, I report any child abuse or elder abuse and things like that. So I'm curious as to how that will look in this life in terms of like being a Hindu counselor. So I'm wondering if Arjun can shine some light on it.
I think it depends on which hat you're wearing, Ramayaji. Are you dealing with a client as a certified licensed therapist, or are you dealing with a client as a counselor Hindu tradition? There are two different roles, and you have to disclose to the client in what capacity you are dealing with that client. Does that make sense to you? Hello?
Somewhat, Kailashji, but I'm wondering, if there is more to this that needs to be thought out or consulted from a legal standpoint. So that's why I was wondering if Arjunji had.
Yeah. Ramyaji, I think it might be, and I don't want to provide legal advice right here, but I think you've identified a good point. I think you may have obligations when you get your license to report, and again, it might be good to talk to someone who is familiar with the rules of your board when you get your license, and whether that obligation might extend into even in situations where you're clearly not acting as a licensed psychotherapist or whatever, whether the obligations extend to that. You may want to separately look into that. But I'm not. So the board may have their own requirements and ethical requirements and so on. So I don't want to provide legal advice on that here, but it may be worth probing into a little bit more.
Good.
Sure.
Punitji,
Sure. Thank you so
have
much.
something to add on this, Punitji? From your
Yeah, no, actually, Ramyaji has a really valid concern, and we do need to check in with someone, who's kind of more knowledgeable about this. Because there could be a liability there, especially if if there really is a concern. Yes, I understand you were volunteering, but you're a licensed therapist, and as such, though at home, if we come across something, or when we are meeting with family members who might have something come up, you might not. But if you're going and having a structured counseling session, that does sort of fall in between. Having said that, if for domestic violence, therapists don't have any fiduciary obligation to report. So the only time really you have that obligation is whether it's adult abuse, physical abuse, neglect, or financial abuse, or child abuse or neglect. So in both these scenarios, you can kind of err on the side of conservative and report it. I mean, if there is child abuse, you report it. It may very well be that when you're wearing a therapist hat, you're being a little bit, you're checking each time with the board, hey, I want to report this, whether they take the report or not. And maybe as a volunteer, you kind of report it only when you think it is reportable. But it's a question I think we need to ask someone, even because Ramya ji, I have my private practice and I have my work, and at HCI I'm not working in the capacity as a counselor, so I don't have the answer for you. So it's a valid point, and we may need to check it out.
I think we'll also look at it. I'll also approach some people and hopefully together, but keep that logged down as an open item, and you work on it, we'll work on it. Okay. Any
Okay.
other?
No, I think Mahalakshmi ji has raised her hand. Mahalakshmi ji, please talk.
Yes. Hari Om, Namaste. Thank you, Arjunji and Kailashji, for that very extensive presentation. I must say honestly that it did throw me off. I'm a layperson in terms of not having any kind of counselor background. So initially it did throw me off, but I can see, as Kailashji very nicely pointed out, is the overall picture, and to some extent instills upon us what this can entail when we intend to serve. That being said, I was just curious with the history in the past with the 3 cohorts that has gone on, if any person who has actually engaged in this kind of service, what kind of experiences they have gotten, what they've learned from it. Are there any that, like me, I'm feeling right now, like, I don't know if I'm capable of doing it, although my intent is good. Looks like there's a lot of cautionary things one has to be concerned about. So I'm just curious, although I do not deny this is all very relevant and it's important for us to know, if there is anybody who, not just in this session, any other sessions, if it's worth it for us to, hear from somebody like that, how did they go through the process, doing it on a new, first time basis, and their pluses and minuses, what they learned from it, that could be valuable. Just a request.
Okay, so I think the answer is a very short one. We do not have extensive experiences yet. We graduated a couple of classes, then pandemic came along, and so people are now going back there to starting to serve. All the requests that have come in so far have been mostly relative to Hindu tradition and tragedies in the families and last rites and all that. And we have very capably handled them in a sensitive way among ourselves as a group. So when something happens and you don't have the right answer, they come to the right person. And we work as a kind of a sangha, as a community, and we have managed it that way. We don't have a big, and of course there have been no misses or any mistakes so far, but it's good to have a very keen awareness of the responsibilities that we all have upon us. And back to the ethnic, our Indian cultural kind of a base, which we have so much affection for. But in this case, we have to also recognize that some places you have to keep the boundaries and separate that relationship in that way.
And Anjana ji, you will always have a mentor. So you can always check in with the mentor, and the fact that you have that little voice saying, no, not Anjana ji, Mahalakshmi ji, you shifted on my screen. The positions got swapped. So Mahalakshmi ji, so I mean, the fact that that little voice is saying, gee, should I not, or can I not? I mean, that's good, because that's going to keep you, checking with yourself. But as Kailashji said, most of the services, most of the time you won't encounter issues, once in a while they may come up, and then there will be a mentor, and there's all of us that you can ask. So you're not alone. Even when there is situation is that when you have to report, say something, you still have like 48 hours to do that. So that's enough time. You know, you don't have to like right away there and then do something, right? So, I mean, unless someone's life is being threatened, then of course you just call 911, whether it's your client or whether it's your client is threatening someone. It's, and as you would do that even at home, like even at home, if somebody, you know, some you go and visit someone's house and some scene of that kind is manifesting, you know, you would call 911 in that scenario, you do the same thing.
I think that's a very good point, by the way. So we'll always have a mentor. You'll always have a contact. One of us, somebody faculty or somebody board member. But the other good thing is that we are building a Sangha. We are hoping we'll have 1,000 CHTs in 10 countries by 2025. So you're going to have a great network. And thanks to all the electronic and all the WhatsApps and all the groups, anytime you have an issue, you're going to have some sharpest brains that you can connect with without invading the privacy of the people you're talking about. But you can present the issue, and I can guarantee you within minutes and hours, you will get a tremendous amount of response and support. So you should feel very positive that you will never be out in the limb, making these decisions.
And I just wanted to point out, so then there is legal and then there is ethical, and these are two different things. So, that you do have a mentor, and when it comes to privacy and confidentiality, they are more ethical kind of issues. And if you were to discuss that with your mentor, and if a mentor is not available, you take into confidence a senior HCI counselor, know that you are okay. I mean, ethical requirements are different. You kind of operate from that realm. But if you have to share information in order with the intention of keeping your client safe and well, it would still be okay.
Yeah.
You don't share it with your family members, but you can share it with another colleague.
A colleague.
Yeah, so
Thank you so much for clarifying.
Yeah, Nishtha ji have raised the hand. Nishtha ji, would you please ask your question?
Hanji, thank you, NKG. What I wanted to find out is the people who've already graduated, is there some sort of a database where it delineates the kind of situations that might have occurred and how it was handled, so that maybe we can even reference that when we have something similar occur? I mean, without naming names or anything, but at least some place where, if it was like, let's say, child abuse or spousal abuse or something, like who is the go-to person in those type of situations, and what was the best way to handle it, the best practices and so on.
So we are again coming back to we are a startup, the very early stage. We have got some case histories, and again, Mangalaji will talk about that next week again. Some case histories of what we dealt with, some situations. We don't have 100% complete documentation of all the cases yet, because it's a volunteer organization. So gradually over years, we will build that database, and you'll be able to get that information.
So so just to follow up on that, like let's say for certain situations, there are going to be certain go-to people. So is there something set up where we can at least talk to those experts in their arena? Like Arjunji is in legal, so is there some sort of a
Arjunji is a kind of an advisor to the HCI.
Mm-hmm.
But what we have is we have 16 services we listed before. We are going to have those built over the time, and for each service we have what we call service the subject matter experts, SMEs. And so those are identified in some areas, all the Hindu tradition related areas, lust rites, celebrations. We have some on marriage, pre-marriage discussion. We have some guidance there and some expertise there. Parenting, we're just beginning to build that. So we are, building these service modules, and the expert kind of a knowledge providers. And depending on your need, again, as I said to you, if your need comes up, you will be able to find somebody within the network of HCI to get you the support. Okay, and we're going to build it over time. We don't have it all here. Here we are an early stage company. Okay.
Perfect. Thank you.
Yeah, thanks.
So if there is no question, I think I will share a slide for the homework.
Yeah, please.
So this is session 4 homework. There are 3 questions, and you can review the question. This is also posted in Moodle, so you can review it there also. And if you have any question related to homework, you can approach me. So my contact details are given. You may email me or WhatsApp me here on this number. So question 1 is, what is the role of a worldview in counseling practice? How would you define your worldview? For around 150 to 200 words, you have to answer this within the given time frame, which is November 21st for global group, and for ANZ, Australia New Zealand group, November 28th. So this will be cut-off date. So kindly start working as early as possible. If you have any question, any problem or issues, let us know so we can consider it. And question 2 is, practice using open-ended questions at home with your family and friends and summarize your experience. So this is also 150 to 200 word answer. And question 3, what ethical principles do you see as being a challenge in working with Indian community? It is thought-provoking question, around 200 words. So anybody has any question about the questions?
I just have a comment.
Okay.
I just wanted to say thank you for, constantly bringing the homework questions through the presentations as well as here. Although our goal is should not be result oriented, it does give, it elevates that little stress or whatever for many of us who, constantly think of homework, and really put some relevance to kind of keep that in perspective while we're listening to all the presentations. So thank you so much for that.
You're welcome. Anybody else has any question?
By the way, I can add.
Yeah, go ahead, Kailash.
I want to say the advice that I have from the last few years of experience is the fresher your homework is from the class, the most efficient your learning and most efficient your time management would be. If you delay it by another week, it'll take more time. You're going to go back and look at video and all that stuff and the slides. So I encourage everybody to take the time and get this done as soon as you can. But it's been a very good class today. Enjoyed your interactions. And I think we are pretty much done for our, unless there's any more questions.
I have a question on question 3.
Yes.
What ethical principle do you see as being a challenge in working with the Indian community? So let's say if you figure out one of the principles, do you have to elaborate on that principle in order to make it up to 200 words?
I think you can describe, elaborate. It should be principles, not just principle, by the way. That should be plural. It's not one principle. You look at different ones, right? I mean, just think about one of the things we do. The privacy becomes one of them, right?
Yeah.
So,
and then you can explain as to why, right? If privacy is, then why is that an issue? I mean, you talk a little bit about, the how it's a collectivistic environments. People are close to each other. Their, boundaries can be, so you kind of explain that from your point of view.
So are you saying that you can pick, you can say, you can state one and elaborate on that one, or you have to state multiple ethical principles?
I'll leave it up to Kailash because it's his.
I think we made a mistake. It should be put one more principle. So we give examples of principles. We're not limiting it to one.
Okay.
What are the things we do as an ethnic group in our cultural upbringing? We freely share information about each other. Okay, really talk things over. We give gifts without any questions. We accept gifts without too much qualms about that, right? What are just look at our behavioral conduct in our communities with all the emotions and all the positive intentions, how they may counter some of the conduct things we talked about in the class. We just write those down, okay? We're going to make that principles, by the way.
Okay, I'll correct it.
Why down what ethical principle and conduct? Principle and conduct, code of
And
conduct.
Okay.
What ethical principle and code of
And
conduct?
code of conduct. Okay.
And code of conduct.
Okay, we'll revise it.
Yeah, please add those words, and then you can take your, and I think you can just elaborate on those and why are those challenges? Why are they a problem?
Okay. So I think we are doing good on time. It's 4:48. We'll have a closing prayer now.
Yeah.
So let us sit comfortably. Everybody sit comfortably. Keep your back straight. Your spinal cord, neck, and head should be in one line. Drop your shoulder. Relax. Take a deep breath for 3 times. Inhale deeply through nose. Exhale completely. Again. Inhale. Exhale. Inhale. Exhale. Now inhale deeply and while exhaling, chant a long Om followed by another breath and a short Om followed by the prayer. So take your hands above your head, clap them, join the palms and bring them between heart and chest center. Inhale. ॐ सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः. Keep your eyes closed, take your hand behind, hold your right hand with left palm at wrist. Inhale, bend backward. Exhale, bend forward and do Bhu Naman. You respect to Mother Earth. Inhale, sit back, sit up. Do not open your eyes, rub your palms. Generate energy. Feel the energy by separating palms a little bit and cup your eyes. Slowly blink your eyes 2 times and open your eyes. Dissipate the remaining energy in your face, forehead, throat, neck, and whole body. So we prayed today in the closing prayer. Say Om. May all be happy. May all be free from illness. May all see what is auspicious. May no one suffer. Om, peace, peace, peace. Namaste. Thank you for joining today's session and hope we have learned something new today. Looking forward to seeing you again next Sunday.
Thank you. Thank you very
Bye.
much.
Thank you.
Bye. Thank you. Thank you for the nice messages here.
Thank
Okay,
you.
bye.
Thank you, teacher. Bye.
Yeah, thank you.